these two. They're just, so yeah, these two are over. In fact, all three balls. These are all from the switches back. That one's on my head. And then that one's just like.
Keep it down up there, Bob.
Cynthia.
Right here, right here. Oh, it needs to be over there. Oh, yeah, that's good.
Mama, what about Mom? Ellen.
Yeah.
I brought my sweater today. 'Cause last time I was here,
I think that's.
I have Leon, so he's like, yeah, it was one of the.
I think it's that.
I still like your accountant joke.
It's too short.
Maybe. If you're still in a good job.
Oh, that's nice. Yeah, she's just running. You're gonna have to wait. Yeah, she's on her way. What's the best one? I love it. Looking for Google and start as soon as we get done. It's so good. I was looking forward to that.
Good evening, everyone. I would like to call our meeting to order and thank each of you for your attendance, whether you're here in person or through the live streaming. And I just want to say that in order for to assist our patrons and members of the public that watch our live stream and the meeting who are hearing challenged, we will be taking, at least I will be taking my mask off while I speak in the microphone. So I just wanted to explain that. And again, thank you all for being here. Our meeting this evening will begin with a study session. And for those of you that may not be familiar with how we hold our meetings, our study sessions are items of information which the administration brings to the Board of Education for study and review. And so this first item is the update on fall 2020 reopening plan implementation. And I'll turn the time over to Superintendent Rick Robbins, and he will introduce kind of the outline of the topics that they will cover regarding this topic. And so board, I would ask you at the conclusion of each section, if you have any questions for that presenter, then let's take those questions at that time. Thank you, Dr. Robbins.
Thank you, President Tingey and board members. I appreciate the opportunity to address the board tonight and update you on our reopening plan for fall 2020. So I'm going to provide a little bit of an overview, and then I'll back up to introduce our first guest. For tonight's purposes, you can see the overview there on the screen that we'll be talking about tonight. But before I do that, I just want to take a few moments to thank all of you as a board for your support and your input and your thoughts. I also want to thank the administration team that's behind me tonight, and for their countless hours and diligence in continuing to work on our plan and to communicate with and engage our patrons and our parents and our teachers and staff. So recently we've held a tech summit, and I just want to give a shout out to Dr. Roderick Landward and the ISD team, as well as all of our CSD teachers that participated in that. It's been awesome to see their dedication and their willingness to really further their development and their learning with Canvas as a platform to serve our students better in this environment, in a blended learning platform. I just want to start with this statement to recognize the situation, and so I'm going to read part of it. I think it's important that we as a community recognize the gravity and the nature of the situation we are in. These are uncertain and historic times, no doubt. We didn't create COVID-19, and yet we are put in this impossible situation to choose what is best going forward. All of us in education fear the potential ramifications of the virus spreading and impacting not only ourselves, but our children and potentially our loved ones. And this hits close to home for me as a father of a third grade student who is going back to school in person, as well as a spouse. My wife is high risk, immunocompromised herself, and works in schools. I fully understand the trepidation and those fears. This is very real. On the other side of this terrible question is our students. And I am equally as frightened for the loss of learning our students have already suffered as well as the deep damage our students may have incurred with their own wellness, physically, socially, and emotionally. The trauma caused by the abrupt stop to school in March has the potential to harm a generation of children for decades to come. And so there we sit. And here we are tonight as a state, as a community, as a nation, and as a world. For me, I would like to say that I have great confidence in the future, and I have great faith in each other. And at the end of the day, in my opinion, it's our relationships above all else that will get us through this. And so one of the things that I've really learned from our special guest that I'm going to introduce here in just a minute, that has brought me great peace in how I personally deal with this issue daily. And that is two principles. One is of personal responsibility. And as we've seen in Salt Lake County, as well as other places, as people begin to take personal responsibility and personal accountability for their actions, we can make a difference. We can make a difference. If we do those things, if we mask up, we distance the best that we can, we practice hand hygiene, we can keep ourselves and others safe. The second principle is looking at every decision we make through a lens of prudence and thinking about others and the future and how we might keep ourselves and each other safe. And these things are difficult, right? These are all about human behaviors that are very hard to change. But I firmly believe that together we can make a difference and that we can overcome this. A lot of work to do, but it can be done. So with that, let's talk a little bit about our presentation. So for me, the goal in mind here is to update the board and the public on our plan on some clarifying issues. And I appreciate our parents and the public, our patrons, for their input and their engagement. Hopefully, they've had most of their questions answered. I totally understand and get that one question and one solution brings another. And I think we're all learning. As mentioned, this situation changes from a federal, state, and even local level. And there's many different messages and information that we're all trying to absorb. But just by the way of chronological timeline, the plan was approved on July 14th by the Board of Education. We have opened registration on July 27th. And I just want to touch on that for a second. As you know, we opened that with 3 official options for parents that are involved in that plan. One is in-person instruction, the second is online, and the third is parent guided. But I think it's very, very important for everyone to understand that within those 3 options, there is tremendous flexibility for parents to choose what's best for their child. And with the 990 hour attendance rule being waived by USBE, that presents our parents even more opportunities to help make choices for their students that are best for them, whether it be their home because they're ill, or whether it's their home because they choose to, or if it's because the parent feels more confident in sending their student to school on certain days more than others. Along those same lines, in the online option, many of our students, especially in our secondary schools, really have the choice to build a schedule that is suitable for them, that may be online or maybe in person part-time. And that is no easy task. I totally understand that, and I want to recognize our principals and our teachers and our counselors and all of our staff that are working around the clock to meet those accommodations for our students. But later in the presentation, you'll see our registration data to reflect currently what is happening with that. So just moving forward, you can see on August the 1st, our plan was submitted to USBE along with the other 40 districts in the state of Utah. All plans have been submitted and those have been posted. And I want to give a special thanks to Dr. McKay Robinson on our school performance team. He is the actual author that wrote this. Obviously, a lot of people had influence and input, but the person that's actually assigned to write the document has a pretty heavy lift. And just so everyone understands, McKay on weekends, along with other staff, have been diligently working and wordsmithing the document to get it ready for submission. So I just want to give a shout out to Dr. Robinson for all of his work. So tonight, before we'll just breeze through these, and then I'll take a few questions before we turn it over to our first guest. But our first guest that I'm going to invite up after I finish is Dr. Brandon Webb. Dr. Webb is with the Division of Infectious Disease and Clinical Epidemiology at Intermountain Healthcare. And he also serves as the chair on their COVID-19 therapeutic committee. And he is a clinical assistant professor with Stanford Medicine. And I got to know Dr. Webb through email, actually, and then through personal phone calls. And I really admire his work. He is also a father to children that attend Canyon schools. And so he's very invested in this process, and this is in his wheelhouse. And so I just want him to know how much I appreciate his guidance through this as we've collaborated, and I've been able to learn so much from him. So in just a second, I'll bring him up. We'll also hear from Dr. Hal Sanderson in Research and Assessment to update on CSD COVID-19 community spread data. I know that's something that we're all very interested in, not just across Salt Lake County, but our state and our nation as we closely monitor this data set to be better informed in our decision making. Also, BJ Weller in our Responsive Services Director will speak to us a little bit about the protocol with positive tests. As you know, the state made a shift in their plan when it comes to moderating or moderate quarantine protocol. And so we'll have some discussion there and some information from BJ. Also, a lot of discussion and questions around face coverings or masks. I think the official language has shifted to masks in the state plan, but we'll also hear from BJ on some guidance for our schools when it comes to masks. Steve Diamond's also here with us, HR Director. I think it's important for us on our employee side to share some of his information about high risk employees and what we're doing to support them. I think, as mentioned before, it's absolutely critical and a priority for us to support our employees the best that we can in the situation that's given, but also talk a little bit about our substitute contingency plan, knowing exactly how that's going to work. I know a lot of parents and patrons have had concerns or questions and wondering about what that might look like. And then our business administrator, Leon Wilcox, will give us an update on our facilities and PPE update in preparation for opening. And I just want to, along those lines, tell our principals and our custodians and everybody that works in our buildings and grounds just how much I appreciate them. I've met with our ESP leadership team now multiple times to discuss what this might look like for facilities. And so everything from looking at air filtration to airflow, talking about how we might reconfigure our seating in our schools to better maximize space and really support distancing the best that we can. So we'll hear from Leon, and then we'll also hear from school performance. One of the things that's part of the requirement in the state plans is submitting local school site mitigation plans. And I'm very proud of all the work that's occurred there. If you've had a chance to look at those, this was planning and engagement between principals, teachers, and SECs. And I think they've done an outstanding job with that. And then they'll also address volunteers in schools. We believe, and it's been a longstanding tenet of Canyon School District, an engagement and a partnership with our volunteers in our schools. And I think that's something that we really cherish and value, that collaboration between our schools and our volunteers and parents. And so we'll talk a little bit about that. And then we also have an update on mitigation plans and strategies for our fine arts program. So, you might be wondering what mitigation might look like with band or choir, some of those fine arts programs. And then also along those lines, as we know, UHSAA released their plan for the fall. And since that time, Salt Lake County school districts have been in collaboration in looking at what mitigation plans might look like with our high schools. And then the final recommendation. As I have met with our teachers and with CEA, one of the things that we've been thinking about, and I fully support, as well as our administrative team, is recommending a adjustment to the calendar and moving our start date to August the 24th. As you know, many of our teachers, once our registration and enrollment's complete, will be making a pivot to online teaching and learning. And so I think this recognizes that time to prepare as well as they change, but also it really gives our teachers and our staff time to look at their building layout and look at different ways that they can prepare for health and wellness precautions. And I think that time will be well spent. So I'll be making that recommendation tonight. What that might look like, you might be wondering, will we need to seek a waiver? Because usually if you go outside the 180-day requirement, as we know, the state waived the 990 rule, but they held the 180-day requirement in place. And so if approved by the board, what this might look like, this would fall under potentially a few years ago. You might remember it was called the Osmond Bill. Senator Osmond passed this, and I believe it was about 5 or 6 years ago when this was passed. But what it intended to do was to give school districts up to 4 days or 32 hours of professional development time or preparation time for schools in lieu of instruction that teachers and staffs could take advantage of without students being present, but also counting as instructional time. And so in Canyon School District, we have not utilized those days. My understanding is a few years back, a few of those days were in play, but recently those days have not been utilized. So it would be my recommendation that we look to utilize that time. Now in the code, and I believe this is in rule as well, but it talks about that there has to be approval for the 32 instructional hours or the 4 days. It needs to be approved at least 90 days prior to the beginning of the school year. And so we may need to seek a waiver on that line in the rule and statute. But I've reached out to State Superintendent Dixon, and from my communications with her, I have full confidence that if approved, we would be able to move forward. And then, so that would allow 1 day potentially that we would need to request a waiver on, or potentially we could utilize that as an online training day, or maybe potentially another way to prepare and engage our students in our community if the choice is to not ask for a waiver. So with that, I'll throw it back to you, President, for some questions.
Okay, board, any questions at this point? Okay, Mrs. Schill and then Mr. Milliberg.
Okay, so Steve and I are on the calendar committee. So I'm just wondering, is this something we need to discuss in the future? Are we just going to leave all the dates as they are, like the end of the semester, the end of the trimester, all the holiday? I mean, everything else will be the same? Or what are you thinking?
With those 4 days being utilized and potentially a 1-day waiver, I would not recommend changing anything else, right? If those days were already built in and potentially a waiver was not granted, and we would have to build those days in later in the year, in the spring potentially, then it would take a larger calendar adjustment. But with those 4 days and with this single day outlier, what I would recommend is that everybody stays as is, teachers returning on the 10th and ESPs returning on the 17th.
Okay, thank you.
Dr. Rick, let's talk about maybe more than 4+1. Okay. I'm sure I'm not the only one that received a plethora of emails from members of the Canyons Education Association today. One of the big requests I see is that they're afraid to go back to school too early. There is some wisdom, I believe, in waiting for the rolling average to decline, although in the last, 3 or 4 days, we've seen a substantial decline coming, but I don't believe that 3 days constitutes a trend. What would be the appetite, do you believe, for the State Board of Education to look at the possibility of, instead of coming back on the 24th, put that out to the 31st?
Yeah,
and if I really were to voice my desire of all desires, I'd say come back on the 8th after Labor Day, which would then give us substantial time to see if we have a trend or not.
Yeah, I can certainly, on my part, I can reach out to Superintendent Dixon to test the waters there. I think, multiple boards are making different decisions about, what that might look like. I know we're not the only district that would be seeking to delay the start, and I think there's pluses and minuses to both. But
the old adage is that pigs get fat and hogs get slaughtered, and I'm afraid we'd be putting our necks on the chopping block if we tried to go till after Labor Day. But it feels like to me, especially if we're offering up those 4 days, that an additional week would certainly be a reasonable request, because I don't know about you and I don't know about Superintendent Dixon, but I have never seen a school year looking to start quite like this one is.
Yeah, for sure.
And I think that we are in exceptional times. And I think that an additional week would be an exceptional measure. So that's just my point of view.
I appreciate that, Mont, a lot. And I think, it's important as a community, like I mentioned earlier, to continue to look at those numbers and to evaluate that. And I will take your direction as a board with whichever way you want to go with it.
And I think for all the reasons you've listed why an additional week makes sense, I would really like to make sure that our classroom teachers are ready to go back. I want to make really sure that we have done our level best to provide social distancing in the classrooms, and that we have all those different elements of what's going to make a successful school year last a school year, not 2 or 3 weeks. I would rather sacrifice that additional week up front and feel like we were better prepared to go in and stay in.
Point well taken. Okay.
Mr. Wrigley.
Thank you. There was 2 things, or maybe 3 here. First off, I know the first week of school, frequently we spend a lot of time orienting our students to what our grading policy is and everything else. And in some, especially in high school, when you're reading on an A-B schedule, half the week is gone before you get done. So I would suggest that maybe on that 4th or 5th day, that the teachers try to arrange to meet with the students to sort of do some of that orientation, so that when we do get to school on the next week, that we actually can hit with the tires right on the road rather than wasting another week. In regards to Mont's comment, it's really interesting on the committee, the calendar committee. We often talk about dates and schools and opening. A, B, and days are become an issue sometimes, but because one of the issues I think we may face is a lot of our teachers that teach AP courses, concurrent enrollment courses, teach other stuff like that. We're going to have a hard time getting that curriculum in, even now, taking a week off. That's a common thing that we often have discussed in the calendar committee, is how do we do that? And then I think we also need to, as the data we're going to be getting here later, we can't talk about the statewide data all the time and the statewide trends. I'm really glad to see in the presentation today, we're going to be talking about the canyons trends, which I think are much more interesting than the statewide trends, because the statewide trend pulls in a lot of different areas. So it might be interesting to take a look at that, Mon, is that we take a look at the canyons trends and how that's doing, because I think we're quite a bit longer than the state on several areas.
I recognize both points, Steve. I think to Mont's point, looking at that data carefully, I think it is going in the right direction. How long that sample size is where we feel totally confident. I'm not sure we're there yet, but a lot of positive has occurred over the last month, but we still have a long way to go. And to your point, I think that's a challenge too, right? Getting started and getting back at it and trying to ensure that we can ramp up learning to the level that we expect in canyons. That's going to be a challenge
if
too.
we started in September, basically, we're almost 6 months of no education by leaving in March. That's a long time for deterioration in our children's learning, and then trying to catch up. So I'm really concerned the longer we spread it out, the more difficult that is. And I've got several parents that are real concerned that kids are going crazy right now. If we continue to spread it out longer and longer, it doesn't do the parents very good, because we give them an extra week. They can't go on vacation now because there's no place open. But I don't know. There's a discussion on that. And I think I think it's on the agenda, the last item. So maybe that's the appropriate place to have the discussion.
Okay, thank you.
Okay, I'm going to bring up Dr. Webb and let him share a few of his thoughts, and then if he'd like to stay for a few minutes for Q&A, and then if it's okay, I'll excuse him from the meeting.
Yes, thank you. Welcome, Dr. Webb. We appreciate your being here with us.
Thank you, and thank you for having me. Want to express appreciation to Superintendent Robbins for being responsive, and to the Board of Education as well. But maybe most importantly, as a father of 4 students who attend schools in the district, would love to publicly express appreciation to the teachers and the principals and the staff who, at this time, I would really consider our new front line in the state of Utah. And this is coming from a context of someone who's been working with the frontline caregivers in the healthcare field for months now, combating this unprecedented pandemic, which has in large part challenged our paradigm, even from the standpoint of those of us who've spent our lives and our careers preparing for this type of insult. And what I mean by that is that this virus truly has put us between a rock and a hard place. And as much as we like to silo issues, the reality is that the novel coronavirus has dramatically affected our health, but it's dramatically affected our economy and our ability to educate and our ability to socialize and many other factors. And it's divided the community. And so several weeks ago, my wife and I were talking about back to school and realized as we were thinking about the teachers and the preparation that I have professionally prepared for and been battling this for months, and recognized that as a father of students in the school district, civically, there's probably more that I could be doing. And so with that, reached out to Superintendent Robbins and the board. And I'm here tonight for the same reason I emailed that evening, and that is simply to be a resource in a period of time where misinformation and uncertainty are equal enemies as the virus is. And so with that, I would simply like to offer my assistance wherever possible as we continue to move back into a back to school mode, so that we are making decisions that are based on the best available evidence, and so that we are integrating that best available evidence into a flexible strategy that recognizes that while there's a lot that we do know about the virus and how it's transmitted, there remains a tremendous amount that we do not yet know, including what the community dynamics look like with a back to school strategy. And so with that, and respectfully, I would close and actually offer the ability to answer any questions that I can now or later, and simply taking my father hat off and donning my infectious disease specialist hat for a few minutes. Would love to try to answer any questions that the board might have.
I think we do have some questions. So Mr. Millerberg and then Mrs. Schill. Oh, did you say? Okay.
Dr. Webb, thank you for being here. And this is probably, you know, the most obvious question that I can come up with to ask. I sat in front of my television last Thursday listening to the governor's press conference. And I think I may have actually sworn at the television when they started talking about the modified quarantine. Would you tell me straight, is that really a good idea? Or is it as dumb as it sounded to me that day?
I appreciate the question, and I will
Maybe not
tell
how
it to you as
worded,
straight
but-
as I can without swearing. My job as an epidemiologist and as a physician is to apply the evidence as best we understand it. And the evidence right now suggests that the single greatest risk for transmission to someone else is having been exposed to someone with the virus. And so from a public health standpoint, policies that enable and encourage the public to take good self-responsibility measures, and once exposed, to isolate and avoid exposing others, are policies that I am most supportive of, and I would suggest that the scientific evidence is best supportive of as well.
In not so many words, but did I hear you say that your opinion of the modified quarantine is about where mine is?
My opinion of the modified quarantine is that while certain professions, once exposed, really do need to continue to work with appropriate precautions, that doesn't apply necessarily to all facets of the population. And I think we need to think carefully about where students fit in that spectrum.
Well, and you know, we're between a rock and a hard spot, because I really, really believe that our professionals in the classroom are essential, but I don't know that they're that essential. And I don't know that I agree. I really know that I disagree that our students in the classroom are essential. I just feel like we need to do more to protect our students and likewise protect our professional educators.
Okay, so you mentioned that we should be making decisions on the best available evidence. You said that. So what data points should we be looking at? And are we looking at the right ones? Anyway, so what's your opinion on that?
Yeah, great question. So I've spent now several hours speaking with Superintendent Robbins about the data points that he's been looking at, and not just the data points, but by evidence. I also want to emphasize that our understanding of the mechanisms of transmission are very important pieces of evidence as we implement a back to school safely strategy. And so I would submit that the pieces of evidence that we should rely upon should focus really in two categories. The first being the best available scientific evidence around how the virus is actually transmitted and the principles of transmission, and to use those principles of transmission in all that is done at the district level in creating strategies in the classroom, in the lunchroom, in the school board room. It doesn't matter what room. If our strategy is based on principles that are based on our best scientific evidence, we'll be much more likely to succeed. The second big category is epidemiologic data. And first, just making decisions based on community level transmission alone is an excellent idea. That type of data-driven decision-making will certainly benefit in the long term. And while there's many, many metrics to look at, the most important metrics are the metrics that are most applicable to our population. So looking at Canyon's district geographic transmission rates are incredibly important. And maybe more important than looking at them now, we'll be looking at them after we go back to school, whenever that is.
Okay. Then just to follow up. So I'm sure you've read our plan, right? So looking at our plan, have we done that? Has our district done that, in your opinion?
Is the plan waterproof, in my professional opinion? I think that there are, at the level of every facility, always opportunities to improve. There will be gaps in our knowledge, and there will be things that are identified that can only be identified once school starts again. And so some flexibility is key. But insofar as we're able to project and look, I've reviewed the plan at the district level, and I think from the standpoint of compliance with the CDC and with what we understand about principles of transmission, the plan is sound insofar as we understand it. And I want to emphasize that no single mitigation strategy is more important than others. In other words, no amount of environmental cleaning will reduce the risk of person-to-person transmission. And no amount of physical distancing can replace environmental cleaning. And lastly, the use of face coverings cannot be undervalued. It is a tremendous buffer against the behavioral variation that is inherent to students and especially children, where there's only certain things that we can control. The face coverings buffer that tremendously.
Okay, thank you very much. I watched a press conference today with some on KSL Facebook, and it had a bunch of doctors discussing school opening. And it just came to mind what they said is that we're layering on the mitigation factors, right? So it's kind of what you were just saying, where not just one factor, but we're having multiple factors, multiple ways we're going to mitigate the risk. Anyway, thank you.
Yeah, absolutely second that. And I think that that's an important point to emphasize is that masks combined with social distancing, combined with hand hygiene, combined with appropriate environmental disinfection, and most importantly, combined with a sense of community engagement and self-responsibility is our most sound strategy. And I would also suggest that it's not a new strategy. We've been using it in the healthcare industry since March in a setting that is equally high risk, and a setting where in March, when we didn't know what to expect, was a setting where we encountered the same palpable fears that I'm sensing as we go back to school. And yet now in August, we're looking back and we're recognizing that we've learned a lot from our experience. We've adapted, we've made changes, but we've been successful using those same strategies and same principles that are being proposed for the back to school strategy.
Thank you.
Thank you, Mr. Wrigley.
Yeah, first off, I want to thank you for your willingness to step forward and provide your professional expertise. In these times, it's real hard to serve in any type of public position because no matter what you say, somebody will say something different. And as we see with the science nowadays, one report comes out today and another one contradicts it the next day. So I really appreciate your willingness to come forth and personally support us and work with us on this so we have a really sound plan. There's a couple of questions I had to ask you. I've a lot of concern comes in. We've probably read 800 emails, maybe 9, plus other talk with other people. The difference between wearing a face covering and wearing a mask, and is it important to have a mask with a shield, or can you just have a shield without a mask? All of these questions come in on all the emails. And what do you think is adequate? I mean, a face covering, and I don't know if our districts would qualify a face covering just as a mask, but face covering could be a bandana, could be whatever. Is there any difference between that? And what are your suggestions? I have had teachers ask me questions and be concerned about just having face coverings, concerned about just having masks or just having shields and not masks. But it's difficult for our teachers because how can they have a mask on and convey anything through their face in teaching? So what are your recommendations in that area?
Yeah, I appreciate that. Those are identical questions that we had to address in March with the frontline caregivers in the hospital setting. And a lot of that has to do with the data that is available and the data that we don't yet have with respect to how effective different types of personal equipment are. The guiding principle in all of face coverings, regardless of the type, is that it's a population level source control measure. And what I mean by that is, more importantly than being an individual protective equipment, is the principle of masking a population. Because when you mask a population, you dramatically reduce the transmission risk in that population, more so than the individual protective ability of any given article or design. And that said, there are some differences. There is now research that informs us. Masks that enclose the nose and the face, that are of material that is not easily permeable, are the most successful. And cotton cloth has actually been demonstrated to be among the most successful materials for catching droplets, as simple as it is. So we could go on and get in the details of that, but the principle is that the more comprehensive our masking is at the population level, the more significant the benefit is in terms of mitigating risk.
So is a shield without a mask on it of no value, or is there value for just having a shield on? Because we may have children that will not wear a mask, but we can get them to wear a shield, or same thing with the teachers. What is your feeling on that?
The shield is less effective than the mask at capturing the droplets that are emitted when we speak. And one of the important principles that I've talked to Superintendent Robbins about at length is actually a Charlie Brown principle. Pigpen, we all understand what Pigpen looks like in that comic strip. He's surrounded by that small cloud of dirt. At the risk of being too informal, that cloud is a very good representation of what the virus does in a person who doesn't know they have it. the cloud can be fairly proximate to the individual. And by wearing any type of face covering, it dramatically reduces the amount of cloud that's coming out.
Mhm.
And as you'd expect, just a face shield alone just doesn't do as adequate a job as any type of covering.
Great, appreciate that. The other question I get in quite a bit, and it's really sort of an argument, is for some people, is you have to have 6 feet. And if you don't have 6 feet, then we just can't start school. But yet at the pediatrician's report that came out, I think it's the original one because the secondary one changed a little bit, said that between 3 to 6 feet, and sometimes that wasn't based upon what was going on. What are your feelings on that? Because I mean, I think in many cases we can make 3, 6 really limits in what a school district can do, and the number of, unless we put on a lot of portables, as far as what it can do. So what are your feelings in regards to this distance issue?
Yeah, so the science behind distancing actually reflects our understanding of not just the SARS-CoV-2 virus, but other coronaviruses and other respiratory viruses. We have a lot of experience with how those are transmitted. And the science actually is not definitive by some set number of feet. The science is that there's a spectrum of cloud surrounding anyone who has the virus. And that for most people, that cloud is actually, because of gravity, the droplets fall to the ground within a radius of about 3 feet. And so 6 feet adds an additional measure of protection. Someone who's coughing or sneezing or shouting or panting could be expelling droplets far in excess of 3 to 6 feet. But again, the layered approach is what's critical, because physical distancing is not universally applicable, and face coverings dramatically mitigate the deficiencies of the distancing. And so 2 individuals, one who's shedding and doesn't know it, and one who is exposed, who are 3 feet away briefly for seconds, may have very little risk. Same 2 individuals who are in close proximity for several minutes or for half an hour would have much greater risk. Those 2 individuals, if both wearing a mask, would enjoy a more than 90% reduction in the risk of transmission. And so those principles are important and can be applied in every setting, in the classroom, on the playground. The principles are how contagious one is. And so keeping sick kids home is important. How close together individuals are, whether there's masking involved, whether high-touch surfaces are clean, and this concept of self-regulation, where the duration of time that we're exposed is minimized. All of those work together to reduce the risk. And we know they work because we've been applying them in the healthcare setting for months now.
Great. One last question to you. Over the time, they've been trying to compare this to the flu, and they were really concerned, at least when I was listening to this at the very beginning, because the flu comes during the winter, then goes down during the summer, then hits with a roar coming up in the winter again. There were some people who were saying that if we sort of flattened out with the contravirus, it was actually better than the flu variation and then coming back. What are your thoughts, or what are the fields? And the field is talking about just the future of this disease.
Yeah.
And a second wave coming back in October, November, December.
There's a lot we do know. There's a lot we don't know. This is the first fall. This is the first flu and respiratory virus season that we will encounter in the era of COVID-19. And to project that based on what we do know is inadequate. We will learn this fall what the dynamics of the COVID-19 disease are in the setting of flu and other respiratory viruses. And we will learn what the dynamics are in settings where the curve was spiked and then has decreased, like we've seen in Europe, for example. And we will also learn what it looks like in environments such as ours, where the curve's largely been flat but stable in a sustained community transmission. The answer is that's one area we don't know yet. And we're going to need to apply a data-driven monitoring plan and make decisions accordingly.
Good. Now, one of the two flus this year is H1N1. It's been around forever. Used to be almost considered a pandemic at one time. Will this flu basically eventually become like the H1N1? I mean, this contravirus become like the H1N1. It will be here for a long period of time.
There are more than 30 coronaviruses. Previously, there were a couple that were localized to specific populations or outbreaks, SARS-CoV-1 and MERS. The other 4 have been in our community for years, since the 1800s at least, when they migrated from animals to humans. They cause respiratory viral infections like the cold. Those wax and wane, but they don't ever go away. And it is not unlikely that the SARS-CoV-2 virus will become part of our portfolio now. But in what way, we don't really know yet.
Thank you so much for your time coming tonight.
Yeah.
Thank you. Any other questions at this point? Oh, yes, Mrs. Oakes.
Dr. Webb, thank you again for all your contributions. I can't imagine how busy you've been. And to offer your time freely like this really makes a huge difference for all of us. Couple questions. I'm wondering, just for the public, I look at your professional credentials and I think there's a part of me that understands it, but I would love for you to kind of give us like an overview of some of what you have been doing in layman's terms to give the public a better appreciation for your background and expertise, the context of your comments. And my final question is, based off of the plan that we have set forth as a district, are you sending your 4 children back to school?
There we go. That's the, put the rubber to the road, huh? I'll answer that one first. Yes, and each of our children had a different experience with the online learning in the spring. Each of my children has different learning styles, and it was not a good fit for 2 of them. And we saw a significant decrease in performance. We have a straight A student who went to performance levels that were not straight A. We are appreciative of the flexibility of the 3 choices and are making use of 2 of those choices with our kids. But yeah, we're going back. Just really quickly, my credentials. So I have an undergraduate degree in microbiology, which just means that I'm a nerd to begin with. And then I went to medical school and did internal medicine and a chief residency year, board certified in internal medicine, and then did additional training to board certify in infectious diseases and care for patients with all kinds of infectious diseases, viruses, any type of germ, essentially. And before COVID, a lot of what I did was work with the most vulnerable populations. So those who are undergoing transplants or cancer treatments, whose immune system is very low. And in addition to treating infections, a lot of what I help with is helping those severely vulnerable patients prevent infection. And so I've now pivoted, and a lot, it's basically all I do these days is COVID, unfortunately. But the principles apply. So within the Intermountain system, since February or earlier, I've been part of a team of other specialists in my same field who have been working virtually in every aspect of prevention, treatment, environmental control, personal protective equipment to combat the virus. So I feel like at this point, while very satisfying that I've trained my entire career and much of my life to be able to be an expert in this, I've transitioned now from a state of curiosity to more of a state of sympathy for the many ways that it's impacted the community, not just by overflowing our hospitals, but by impacting mental health and social issues and education and the economy and everything else. And this is truly a community issue, not just an infectious disease doctor's issue.
Dr. Webb, thank you so much. We appreciate your time and your sharing your expertise with us. It's been very helpful, and thank you.
Thank you.
Okay, let's see. I believe next up, I will introduce, Dr. Hal Sanderson, Research and Assessment, Director of Research and Assessment for Canyons District. Dr. Sanderson.
Good evening. So I just felt like I made it through a test when you were kind enough to ask an epidemiologist on the spot what data they should follow. And I was sitting there going, geez, I hope we're close. And me personally will be okay with what he says. So I will present our community data on COVID-19. Obviously, I'm the Director of Research and Assessment, but I can do a lot of research and look at numbers. But I haven't really created any of this data at all. All of this and the source of the data is through the state Utah Health Department, as well as the Salt Lake County Health Department. And both of those departments do an excellent job of transparency and being able to present their data that allow someone like myself as a researcher go into drill in maybe a little bit closer to what we're looking at. And so that's what I'm doing tonight, is looking at Salt Lake County, but within it, we can look at our Canyons community by zip code and by city name. So I appreciate and thank them for that to help move this discussion as we prepare for the opening of schools. So to start with, this is frontline when you go into Salt Lake County Health Department and look at their COVID-19 data dashboard. As we were talking about it, you could pick a lot of different ranges of time, but I felt like kind of towards the end of school to where we are now would be able to kind of represent what's happened through the summer and where we are today. And so that's representing the end of April to where we are as of Monday at 2 p.m. And that's just representing the Salt Lake County trend. And you can see where there was the peak in kind of early to mid-July and to where things are decreasing as a pattern. When you go in here to the side, you can see that if you do a shift control click, you can pick multiple cities and communities to add the data together. So that saved me hours of math, and I appreciate them doing that. And they built the chart, so again, kudos to them. But you can see where we are, and we have a similar shape and a pattern over those periods of weeks and months. You guys are used to this with me in any data that we talk about, whether we're looking at achievement data over time, and whenever we have either a spike or a decrease, I always am trying to remind you of, let's not get overly excited or extra concerned when we have that one data point. We need additional days when we're talking about end of year data. We need multiple years to be able to kind of look at what that pattern is as to whether we're increasing in a positive way with student achievement, or if we may need to make some pivots with curriculum or strategies. And so this is that same regard. You can see that there are some spikes of days of testing, but you need to kind of focus on the general shape of that data. And it is decreasing, and some other data will show that a little differently. But
Dr. Sanderson, I do have a question though.
yes,
So when you look at the Salt Lake County hospitalized 175, and then you look at the Canyon School District, you also have hospitalized 175. Is that because we're using Altaview Hospital as our key?
no, thank you for asking that. Good point of clarification. If you see under two boxes up there, it says county-wide, and the current hospitalized as well as people tested are the only two boxes that don't dynamically change when you click the community information. So I do appreciate you letting me clarify that point. But it is there, but I wish it could be a little bolder. So there are 2 of those boxes that do not dynamically change. So it's not that hospitalization or anything for whatever reason with how they set that drilling in. Those 2 pieces don't change. Thank you for asking that clarification. So there's, I guess, about a dozen or so key charts from Salt Lake County Health. 2 or 3 of them, like the previous chart that I showed you, you're able to click by city. And so I've clicked by cities to say, how does it look for canyons? Other screens and data views have it organized by zip code. So I bring this up because we're going to look at the zip codes of our canyons community, but it's public data. But if anyone wants to go out and look at it, just realize some charts say click by city, and then some of them have click by zip code, and they're not exactly the same. But the patterns, I've looked at both, and the patterns are the same for us directionally as a district as we look at things. This is charting by zip code our number of COVID cases by week. And it still looks busy, but I'll tell you, I have added them together for a true canyons chart, and I probably should have added it, but just running around, I kind of forgot. But I'll tell you that the peak of that data coming together of our communities was the July 6th through the July 12th week. And when you look at the top chart, like Midvale, their peak was earlier, but if you notice a lot of the other zip codes in Sandy, their peak was in that July 6th, July 12th week. Those total number of cases were 321. So if you were able to add those up, if I put the numbers, you guys would be dizzy with all the numbers on. But it adds up to 321, and that was the peak for our canyons community on the number of positive COVID cases. But just, I use the word community, so it's very important, and be clear about that's anyone from birth to old age. It's any individual who has a positive case. Probably to identify individuals, they don't let us drill in by some grade spans. I would love to be showing you K-12 data for canyon zip codes. But I think because of the small number of cases, they're not allowing us to drill in on that. So this is from birth onward number of COVID cases as a qualifier.
And how that is just the number of cases that has no representation of how many people live in that zip code.
That is correct.
Okay, so
Good point.
Doesn't give me a feel for a percentage of the number of people that.
Right, and it does vary, and I could provide that to the board after. We do have the counts of that by the zip code. That's a good point. But I'd like to say where we are now, hot off the press, where we pulled that again Monday at 2 when they released their 2 days of data. That's where our numbers are now. As you see to the end, that we're at 180 cases. You can see across those zip codes, generally they all have gone down. Some of the largest decreases over the last few months, and especially from that peak of July, is our Draper community, as well as in Midvale. Midvale was around 72, 73 cases, and is down to just under 40 cases on a given week. So almost cutting that in half. So the total number of that is 180 cases that we're looking at for our latest week. And together from the peak, that represents a 44% decrease in COVID cases in our community. That's descriptive. I will politely ask none of you to ask me what it's going to be over the next 3 to 4 weeks, but I will tell you descriptively, our cases are going down.
You don't have a crystal ball, huh?
I do not.
Good thing.
Now, another way of looking at this similar information is to look at that peak of the first few weeks of July and then look at the last few weeks of July. And so this is just showing a way of looking at the percent of positive cases. It's another one of those key metrics that people are looking at. And I have up there where the U.S. Surgeon General threw out wanting to see positive cases less than 10%. However, I've learned that between CDC, Surgeon General, and about 5 large national groups or voices, there's not a consensus on exactly the numbers. But what I do want you to, as you look at those numbers, there's a very clear pattern that from the start of July to looking at the last few weeks of July, those percent of cases being positive are decreasing, and that's going in the right direction across the board except for Cottonwood Heights. But you can see the Canyons community is just adding those together. I have the Salt Lake County and the state of Utah. Now the state of Utah had to add 30 days of data. They don't quite let me click it together, but I've looked at that 2 or 3 times to make sure my calculations are right. But I want you to look at the direction that you can see those drops. And you can see that, again, Midvale has had one of the larger decreases. No crystal ball, but we hope that those patterns and those trends continue. How are we doing so far?
Good, great.
I think my last slide, and this comes from the state of Utah, so we're looking at state data. And this one is showing the epidemic curve. I feel awkward, like Dr. Webb should be doing this. I just had this flash. You can see that it's looking at 3-day averages, and it's trying to say whether we're our percent of cases out of 100,000 are increasing or growing over a period of time, whether they're basically a plateau or level, or statistically if there is a decline in the number of cases per 100,000. So getting ready, I decided to look up what the per incidence of 100,000 calculation is, and I was able to go in to our Canyons data. And around that peak of mid-July, we were right at about 20 daily incidences on average. That was below the state, but it wasn't tremendously low. And then in the 30th of July, as I was getting ready to post the presentation, that daily incident was just under 10. And as several of you have mentioned, the cases over the last few days are again trending in the right direction. And I calculated that for our last 2 days, and that's between 7 and 8. So it's still lower than that 10. Again, it's going the right direction. As Dr. Webb talked about, all the layering of the practices and the behaviors that we should be doing, that collectively, that seems to have an indication of things going in a direction that we, at least I'm pleased. I don't know what emotion or how to label that, but I'm pleased to see things decreasing. So that's the description of kind of where we are over the last few months, and then drilling into more recent patterns. Are there questions about the presentation?
I just have a quick question. I was talking to a teacher, and I pulled up this website, and I was talking about that, and he goes, "Oh, I wish I knew this information, because it's quite different being a teacher in West Valley or Salt Lake City than it would be within our district as far as the data." How do you get to this data for people that may be listening, to parents?
So on that first slide, I have the web link, but if you Google it, you can get to Salt Lake County or to the state, the case count. I do like the county. If people live in Salt Lake County, you can look at your specific zip code. So if you're in Magna or in Mill Creek, or South Jordan, you can pull up your own cases. Obviously, we're focusing on our Canyons community, but it is nice to see that transparency of that data. And you can look at it over time as much as you want. And as Dr. Webb talks about, continue to monitoring, I guess that the superintendent and I will continue to text every week on where things are going.
Well, I like this option, because the news may try to sensationalize this if something goes on in a certain area. as we look at our getting people back in, our students and stuff back into class, it would be nice to be able to pull this data to see if that's making any difference. Then again, you also have to take in situational stuff. If there's stuff, for example, in Midville, homeless centers have more this going on sometimes. So a lot of times we may get some skewed statistics.
It is. They do have, it's called, I think, incident outbreaks on the Salt Lake County. And they have about 12 slices of data. And not a lot of people look at that one, but it really shows the number of cases by these incident clusters. And, it's a misfortune, but you can continue to see the cases that are in those long-term care facilities.
Yeah, and
Those
we
are
have
just
quite a
cases
few
that are
of those
positive,
in our
and it's-
city too.
It's pretty dramatic as you watch that for the county.
Yeah. So it'd be helpful as we take a look and take all that data in, especially if we can't look at by age group, which is really small within the children, but to take that in to find out, because we have a large number of care homes in Draper and Sandy and this area, and
That's correct. And
also have the in Midville has the homeless shelter. So we got a lot of different specific things in this area that may or may not be affecting the schools.
And the Salt Lake Tribune, I think a few days ago, did a specific focus and data look and talked about the number of long-term care facilities on this kind of east side bench in Salt Lake County. So as I was preparing for the presentation, looking at our data, it was very helpful for me to see that. It is not the same across age groups. I know that Dr. Webb began to kind of talk about it, but when you tease it apart, it looks very different depending on those age groups and spans.
Yeah, it'd be interesting if we could somehow, if they don't release it in public, at least somehow figure out what that data is within the nursing homes and that effect upon our communities too, as far as death dates and stuff.
I thought I saw some data that was separated by ages, but not specifically what we needed for K through 12. But there was some for K through 14, if I'm not correct.
There's a few. The state has a few, and the Salt Lake County has one. I had that as an early one view to look at, but since we were trying to zero in, but Salt Lake County does have it by age groups. They have it by either, I think it's 0 to 5, and then 5 to 19 or something like that. And it's important to kind of look at that. You can see that the cases, hospitalizations, ICU cases, and then the mortality by those age spans. And you can see that it's not equal at all in it. The elderly are certainly prone to have all those cautions that we talk about are well warranted. I think that's a fair conclusion.
With other physical problems that are going on with them
Right.
too. But it seems to me when I looked at it, it was a few days ago, and I could be wrong. Somebody can correct me. I would love to have that. There were like less than 5 cases for kids under 14. I might be wrong. But it seems like that's what I remember. And then as you get into 14 up to, I think this particular one went from 14 up to 24, then there was more substantial cases. But I would like to have that information too.
I'd be
It's
glad to
there.
do it as far down as I can go. I'm pretty confident that there's county data, but it doesn't let us drill in, but I'll be glad to send that out to the board.
Thank you.
Sure.
Thank you. Mr. Milleberg, did you have a question?
Maybe more of a comment than a question. I think it would be really interesting though, Hal, if we could look at the percent of the population by cities in our district. Because, you could have one, like Midville jumped out at the top of the first spike, but it would be interesting if Midville had fewer people in the population, if that would be really a standout item. Because, with just raw data, I don't get a feel for where we are as far as the percent of the population that's infected.
I can do that as some homework if you'd like for me to try to work on some kind of follow-up. I felt like at least for people to understand the number of cases is really concrete rather than percents or other types of things that could
it's
get.
good information, and I don't want to be critical. I appreciate that. Just my mind is churning, and I'm thinking it would be nice to know if we have a heavier infestation in some areas, not just raw numbers, but percent of the population. And the other thing is I looked at the 84121 zip code. looking at a map, it kind of feels like with Murray and Holiday, you have more out of district than you have in district on the 84121.
That it does go outside our canyons community. And again, that's kind of the best tool that we got.
Yeah, and
It's a good point, though.
yeah, even though they their green line went up and their blue line went down, maybe Murray's just healthier than we are, and I don't know. They're still low.
Again, the direction I think is where the large focus should be, and that seems encouraging.
Thank you. And just to that comment, I too think that's really some really great data on the Salt Lake County Health Department page, and I've been tracking it for a little while as well. And just kind of for reference, there is a chart on there where it does say by city what % of the population of the county resides in that city. And I added up just the 4 main areas of Canyons District, and it's just about 19% population as a whole
Yeah,
of the
also,
county.
yeah, and also on that chart, it shows the group housing cases. So you can see how many are in.
See, Dr. Webb, we're all becoming amateur epidemiologists.
Yeah.
Nancy,
Yes,
You're getting us good here.
yes, thank you. An
help me
additional
out with your
question?
19%. 19% of what?
So the population in the 4 main cities that comprise Canyons District is about 19% of the population of Salt Lake County.
Okay.
Yeah.
I was hearing 19% of the people were
Yeah,
infected.
and then there's, and then there's a chart, and on that same chart, it tells you by city, their number of cases, what % of cases of the county cases it is. So, and I'm an amateur statistician and not even going to try and be an amateur epidemiologist, but to me, it says if our % of the cases of the county is less than our % of the population of the county, then that means we likely have a lower percentage per population than the rest of the county. Am I close in that assumption?
Feels good.
Okay, all right. Any other questions for Dr. Sanderson? Okay,
No,
seeing
just-
none. Thank
Just a
you.
Thank you.
Anytime.
Thank you very much. That's very helpful information. All right, I believe next up is BJ Weller, who is our Director of Responsive Services Department.
Thank you. Do we have slides? No slides? Okay. It's all part of the presentation slides. Good evening, members of the board. Thank you for an opportunity to come and speak with you and give you an update on the new information that we have received through the health department and the state. We did receive some much anticipated direction from the state health department last Thursday. And there is some contradictory information in that 100-page document. And so we are again waiting for some updated information. And Mr. Millerberg, the modified quarantine is one of those questions on what that will look like. We anticipate that may change, that anybody who is considered a close contact exposure, meaning the 6 feet and 15 minutes, whether or not they're wearing that face covering would be quarantined for the 14 days.
You mean prayers are answered?
So, so that is the understanding that we have right now. Some of the other information that we are anticipating from the health department is just some clarification on the exposure definition, that close contact exposure, and what that looks like if and when somebody tests positive for COVID-19. One of the things that I would like to just start off by saying is, When we think about the purpose of public education, there are many different opinions and perspectives on the purpose of education, whether it's political, whether it's economic, whether it's financial, whatever that reason is. Education is, as we all know, critical for opportunities for our students. Education or public schools offer more than just academic supports to our students. They provide that safe and supportive environment, right? They provide the critical instruction and academic support that benefits the students and the communities, not just this month, but long term. It benefits the interpersonal interactions that they get in the school, the social emotional well-being. All of the skills that they learn in school can help them become more successful as they adventure into careers and college and other pursuits. And when the schools are closed, right, we know that they create more disparities between our students who have other resources at their disposal, or if they have learning disabilities, it's harder for them to maintain the same advantages as their peers, right? So I appreciate the plan that Canyons District has presented and approved for the 5 days, because we know that with all of the mitigating factors that we have put in place, we'll never eliminate the risk, but we'll be able to mitigate the risk as much as possible. I appreciated the slides that Dr. Sanderson just presented about the area in our district with the rates of exposure. And like our teachers and other staff members who are anxious about the return to school in the fall, I echo what Dr. Robbins said at the last board meeting. I think all of us, I think 100% of people are a little anxious and a little nervous about what this will all look like. Even though we have a plan in place, even though we are mitigating risk factors, I think there's always just a little bit of anxiety around that. And we know that anxiety is there to keep us safe, right? But we also know that unchecked, anxiety can be harmful for our mental health, where we catastrophize and we can quickly move into unhealthy parts of our emotional well-being. And focusing on the things that we have control over can help mitigate that. Mr. Wrigley at the previous board meeting reminded our constituents and our staff to make sure that we're taking care of ourselves, not just with physical distancing, not just with preventing, but eating better, right? Sleeping more, making sure that we are taking care of all of the parts of our immune system, right? Because all of that together can help us. And again, focusing on what we have control over will make a big difference. I was talking to my daughter this last week, and we were talking about Smokey the Bear, and the saying that he has, only you can prevent a wildfire. We think of that the same with our adults, right? And I appreciated Dr. Webb's comments. If we are prudent and if we are careful, only we can prevent the close contact exposure as adults. We have the ability in most situations to make sure that we're staying 6 feet away from somebody else for the 15 minutes or longer. And the situations where somebody has been required to quarantine has been the result of them choosing to not follow the physical distance requirements and the 15-minute guidelines that we have set in place. And it's a little frustrating from my end and from Sally Goodger, our lead nurse's end, when we're making those phone calls. Like, gosh, you know what? If you would have just followed that and you were able to do that, then there would not be that quarantine requirement. With the risks that are associated with COVID, with Dr. Sanderson's slides, our students are at a lower risk for being testing positive for COVID than our adults. And with our adults having that flexibility to social distance or physical distance as much as possible. There may be some situations where that's not possible, but as much as we can, we have that ability to maintain the 6 feet for 15 minutes. And if we can do that, then again, we will limit the number of individuals who have to quarantine for the 14 days. The other thing that I just wanted to point out, all of the information that we've been receiving from the CDC, from the health department, the state health department, from USBE, that information is intended for every district across the state, right? Regardless of what the cases of COVID look like. And so when we make decisions for our district within this county, and knowing that there are higher rates in the county in other cities than in ours, I think we can be confident knowing that we're making decisions that impact our families and our staff in Canyons District. Just the fact that in our district and in our county, we are requiring all staff and students to wear a face covering, a mask, a face shield. They have to wear something. And if there are situations where families or staff are requesting an exemption, then they just need to follow the IEP or 504 process, or for staff members, the ADA process. And as we've met with special education and with Colleen Smith over our 504 accommodations, so far we've only been able to identify one case where we would provide an exemption instead of just allow the face shield to be that accommodation. And in that situation, it's an extremely medically fragile student, and it's just not feasible in that situation. And the parents are still requesting that child attend in person because the benefits of in person far outweigh the risk of them staying at home socially isolated from their peers. So knowing that it's a health mandate, and that mandate was extended through the end of December, if students are refusing to wear a face covering or a mask, we will follow the same procedures that we do with any non-compliance. We'll teach it, we'll reinforce it, we'll provide them a face covering or a mask if needed. If there's continued defiance, then the students will be referred to the school administrators, who will continue to work with that student, bring the parents in to make a decision. If there's continued defiance at that point, we'll invite them to participate in online instruction, because the health mandate is clear that if they are in our schools, then we're wearing a face covering. So we're providing training to all the school administrators on that process. So I know that there are other slides. There's been a lot of questions from parents asking about, if somebody has been exposed to COVID-19, will we know? And how will we know? That is one of the questions or the misinformation maybe that is out there with the health department. So based on conversations yesterday with the health department and today with the health department, if a student in a classroom is in close contact, meaning that 6 feet for 15 minutes or more, they will be identified as a close contact exposure. They will be notified by either the health department if they're considered high risk, or if they're not high risk, then the school nurse will notify that student and their family that they are to quarantine for the 14 days. And right now, only those who have been identified as close contact will be required to quarantine. So if a student in the classroom that sits clear across the classroom has not been in close contact, then that student and family would not be notified. And I just say that with information that we've received today, knowing that that could change when we receive the new guidance later this week. And so for families who want the lowest risk, right, that they don't want their child to be exposed anywhere without their supervision, the online option is probably the best, right? And for families who have weighed the risk and have taken all the data into consideration and choose in person, then that 5 days a week is the best option for them. And we will notify them again if their student tests positive, but sorry, if they were in close contact with somebody who tests positive.
BJ? As an alternative to 14-day quarantine, could they opt to be tested?
So right now the answer is no, because right now they're testing individuals who are symptomatic. And for the most part, they are asymptomatic, and they say it can take up to 14 days for that individual to develop symptoms. And so they may not have the virus load to test positive. And if they were tested on Tuesday and then developed symptoms on Wednesday, right, then they'd have to go get tested. And that is a little bit frustrating, just knowing that if you test positive, you have to be symptom-free and without a fever for 24 hours without medication and at least 10 days. So the duration is a little bit less if your symptoms are gone before the 10 days when you test positive. But you just don't know how long you'll have symptoms at this point, right? So if they have symptoms, call the number, call your doctor, and they will let you know whether to have your child brought in to be tested. The symptoms of COVID-19, this information has been updated. You'll notice that the headaches have been taken off of this information, and we're focusing on these 6 main symptoms of COVID-19. This information will be updated as we send that information to families as they do the checks for their child in the morning. Our staff members will also need to do a self-check each morning and declare that, number one, they have not been in close contact with somebody who tested positive in the last 14 days, and that they do not have symptoms. And if they have questions, they can call their school nurse. But we're having them declare to us every day that, again, they have not been in close contact with somebody that they're aware of, and that they do not have these symptoms. Okay.
Is there anything out there as far as wanting to take temperatures of the kids as they come in?
So if we do the modified quarantine, if that stays and students or staff members choose to come to school or work at that point, that is when we would do temperature checking at school. But we'll continue to follow the guidelines that the temperature checking is number one, inconsistent, and number two, for the most part, 99.9% of the population will not have symptoms at school, and the stigmatism or the shaming that's associated with the temperature check, especially if we're lining them up. You test, your temperature is okay, yours is okay, yours is not, you wait over here, you know, and just imagine that the whole cooties and the shaming and the bullying associated with that. Right now, the recommendation is to not do that unless, again, if they come back and they're higher risk, then we would do that. Anytime that a student goes to the office with symptoms, not feeling well, we will take the temperature there. So it is as needed. It's not a screening for every single person that walks in the building.
Can I just ask a question on that? I've had a couple of teachers ask me, could they personally take a temperature if they chose to in their classroom?
That is no. Yeah. Now if the district decided to do that, then we would establish protocols for that to happen. But none of our staff have the permission to do that for every student that walks in. That would be through the main office or the nurse.
It's not enough
I'm not sure.
of an indicator either, right? It's just not enough of an indicator, I don't think.
That's correct. And just everything that's associated with that, were the kids playing outside before they came in? You know, are they just hot in that moment? You know, other, you know, people's individual temperatures vary, they fluctuate. And so that itself is not a reason.
Well, I
to
understand that the
discriminate.
thermometers vary quite a bit too, so you could be in my
So,
classroom,
BJ
you okay?
Sorry, Steve.
Yes.
So BJ, on that note, our children are currently getting their temperature taken whenever they go to practice. Will that continue? Should that continue?
So the temperature checks in those situations is yes, because the extracurricular activities are a higher risk of exposure than coming to school and participating in the academics.
And that is also set by UHSAA. So that's not us, that's their requirement.
Thank you.
So it's my limited understanding, it's just not enough of an indicator. So why is it enough of an indicator for an extracurricular activity, but it's not in the school, in the classroom? Like, why wouldn't we do both or neither?
So I can't speak to the Utah High School Association decision, but for general education purposes, that's the reason why in Mass, right, we have 34,000 students in a district. Only a percentage of those students participate in the Utah High School athletics. And so I think it's just a little bit different.
So Chad, also that was set by their medical committee, I think back in June. So who knows? I mean, maybe it will change, maybe it won't. I don't know. But I mean, that was just set up, I think, before we had new data on that. So
yeah,
because we're
always getting information.
I also think that when you think about sports, there's in your face stuff that you're doing, and you're breathing heavily, and you're closer than the 6 feet. You're not maintaining that. You're not having your masks on. I've been watching the soccer kids play. They don't have masks on out there. They're running, they're breathing heavily. They're next to each other. Sometimes, they don't mean to, but, it sprays out a little bit. Whereas in the classroom, if we're trying to keep our layers, and we have the layers of the mask and the layers of the most distance and not being too close to each other for very long, it makes a little bit more sense that we wouldn't have to do that unless there's it's necessary to do it, to take their temperatures. But I don't see any point unless they're sick and they come to you and you can see it in their face. But
yeah, the best defense, number one, is to stay home if you're not feeling well or if you have symptoms. Just bottom line, if you're not feeling well, please do not come, right? And we hope that you feel better quickly. Get the support you need. Number two, if you do have symptoms at school, we immediately invite them to go to the office to be screened by the school nurse and make a decision. And then if they are symptomatic, to be sent home.
So do we have a plan B? I was talking with one teacher this week and they reported to, or actually a counselor, they were pointed out something. Is there a plan B for us here? For example, right now, even now, we have parents that I can't leave my kid at home. I'll give him a Tylenol and I send him to school. So if you were taking his temperature at the very beginning, he'd look okay. A couple hours, he'd go. Is there some options that we're looking at for the parent? I mean, because we're saying to them, just keep him home, but we've been saying that for quite a long time. And some parents honor that, some parents don't. But if they choose not to honor that, it really affects every other student now, even more than anything else. I mean, because if I got exposed to the flu, either I got it or I didn't get it, but I wasn't off school for 14 days. It didn't affect the teacher not going to school for 14 days. Do we have an option or something? I mean, we probably shouldn't, but we may have to say to a parent, if you absolutely have to send the kid, be honest with us and we'll do something with it, versus don't be honest with us.
Right.
And now we've got a teacher out for 14 days and students out for 14 days because you didn't have childcare.
Yeah.
So,
So,
I mean,
so just remember that adults, kids, they'll have symptoms of lots of things, right? And that's why our nurses are going to be invaluable to help us navigate through this. So the three main reasons why we would send a student home is, number one, if they have diarrhea, Number 2, if they're vomiting. Number 3, if they have a fever, right? And there's a number of reasons why they could do any of those 3 things. And if their symptoms are gone, they can always call the school nurse and consult with them and make a decision. If the nurse is saying, hey, you know, we're concerned that maybe this could be COVID related, you know, they could consult with the health department and make that decision, or at that point go get tested, and then make a decision after that.
Yeah, I'm just concerned about the parent that sends a chick. I mean, I guess we'd have to run a massive campaign and
Yeah.
let them, the social conscious, I guess, get on there. Because if they send this kid, because we have been sending sick kids to school for a long time,
Mhm.
and we know that.
Absolutely.
But somehow we need to pass that. And if he does get, I don't know if there's an option for the parent if they say, I'm sorry, I don't want a latchkey kid here all day long, and I've got to go to work. And we may have to come up with some alternative. It might be much easier to come up with an alternative than have half the class out for the next 14 days because we have a kid that's sick.
Sure.
Because the parent sent them.
Yeah. And I'll just clarify on that. You send a student home who had symptoms, but they did not test positive. We're not quarantining other students in that class, right? We're only quarantining when somebody tests positive. Okay. All right. I just have a few more slides.
Yeah.
Did you have a question?
No, I just wanted to note the time.
Okay.
So thank you.
Thank you. So these are updated graphics from the health department. And again, anytime that there's a positive case, we'll do the contact tracing. We will provide the health department with a list of individuals who are considered high risk, and we'll collaborate with the administrator staff and with our students. The health department will notify the individuals who are in close contact considered high risk, because they'll want to make sure other precautions are in place if needed. And then our nurses and staff will make the call to families if they're not considered high risk and meet that close contact exposure. Just one clarification that the health department wanted me to make in regards to contact tracing in schools.
BJ, just so you don't go too fast, just 1 second. Is there a way to move this down so we can continue this conversation so that we're not moving so quickly? Because I think it's really, really important that we get all this, that our parents get all this, and our educators get all this. And I would not like to miss slides and just skip because we have
Yeah.
to start another meeting
No.
at 6:30.
No, I agree. And I
second
just was
that.
reminding people the time that, you know, this is important, but we want to cover everything we need to. So.
Because I do have questions and some comments, and I don't want to not have them, but at the same time, I do want this information.
Keep going.
Okay. Like, I'm not sure what to do.
Yeah. No,
Go
keep going.
slow, do the whole presentation, and we'll stop when we
Yeah.
have to stop
Okay,
and move
so
on.
so just number 2 on this, the health department says on this slide says they will call anyone who tests positive for COVID-19. That is not the case. They said they're not calling every person who tests positive and ask them everybody that they've been in close contact with. They're asking those individuals to notify anybody that they may have been in close contact with to quarantine. But if it's in our schools, that's when they will notify the high risk. We will notify everybody else at school. Okay. We've talked about this. I'm not sure there's any new information on this slide. That was just in addition to the last one. Again, close contact exposure, the 6 feet for 15 minutes. One of the most important things that we're asking our schools to do is to have seating charts in their classrooms to identify where individuals have been. So again, in the event that an individual does test positive, we know who will meet this definition for quarantine. And I do like the blue caution at the bottom. So if we're unable to determine who is in close contact with that person, then everybody in that classroom or the school bus, that lunch, whatever, would need to quarantine for the 14 days. So that's why it's essential for our staff to make sure that they have that seating chart in place So again, that we can make sure we're able to do the contact tracing.
Are we also doing bus seating charts and lunch seating charts so that the kids are sitting in the same tables every day so we know
Yes. Yep.
exactly who they've been sitting by?
Yep. So
Okay.
Jeremy Wardle over our transportation is working with our principals to create that seating charts on the bus so that we can, again, maximize distance as much as possible and do the contact tracing.
Standing charts too when we walk through the halls, or have we not?
So no, so when you're walking through the halls, if it's not that 15 minutes, then you'll be okay.
Okay.
So one thing with this, just a clarifier, anybody who's on quarantine is excluded from extracurricular activities. So if they participate in sports, if it's dance, theater, cheerleading, in anything that's an after-school extracurricular activity, they will not be allowed to participate during those 2 weeks, during the 14 days. So even under the modified quarantine, if they choose to come to school, that's one thing, but they would still be excluded from the other extracurricular activities. And that may be a non-issue if they remove the modified option. And I know Mont will be dancing if that's the case. And this is our last slide for the mask enforcement. And I talked about it at the beginning, just attempting versus refusing and some steps that we'll take to make sure that everybody's wearing that face covering. And to our staff members, I just want them to know that my heart really is with them, that I know that there's a lot of anxiety, there's a lot of uncertainty. And I know that when the district office was required to return over the summer, there was a lot of angst and a lot of, and that's when numbers were a lot higher than they are now. And we have not had any community exposure at the district. People have been really good about wearing their masks and doing that 6 feet distance. My worry is, in our schools, in the faculty room, and in the copy workroom, honestly, if people will wear their face coverings, follow that 15 minutes, only you can prevent, right? Close contact exposure. If they'll remember that, I think we'll be okay. And we'll never prevent every COVID case, right? And who knows where it actually will happen. People are still going to the store. They're still going to family events. They're still going to sporting things. And not everybody is continuing to wear the masks in public. And so that's our plea for everybody, is to wear your face coverings. We know that it's working, and to be really mindful and prudent of our own behavior. Do everything that we can, everything that we have control over, and we'll be able to improve the situation. So thank you. I'll be here all night if there's questions later.
Great.
Hopefully not all night.
Yeah. Thank you, BJ, and thank you, board. I just want to clarify or just make note that the other 3 items for study session, I will recommend that we bump them down to after new business item 6A. So, but we will finish this one. Yes, we will finish this one. Yes, Mr. Milleberg. Yeah.
Sorry, I thought I was done.
Part of your presentation, you mentioned that kids are less infectious than adults. And I don't know if that means that they are less likely to get COVID, therefore they are less likely to be infectious because they don't get it. And that's not really where my question is going. I'm all over a 5-year-old going to first grade being a kid.
Mm-hmm.
I'm having a hard time believing that an 18-year-old getting ready to graduate from high school is a kid. And from what I've been reading and what I've been seeing, about 11 or 12 is kind of the break point where you cease to be a kid and you become a young adult. Do we need to look at treating our elementary schools differently than we are treating our middle and high schools?
So I think the answer is every school is unique. But what we do for training and what we do for reinforcement will look different at the elementary versus middle and high school, right? The conversations that we have could look different. We'll spend a lot more time at the elementary level teaching appropriate hand washing and how to put on a face covering and reinforcing and reminding, right? And with our middle and high school where they're more capable, they're more cognizant, and if they've chosen to be in person versus online, right? That conversation will be a little bit different. With our teachers in the elementary where they have one class, and that's going to be a little bit different than our secondary schools who have multiple students coming throughout the day. And so I think our conversations and our training will need to look different. Also, this may be COVID related or just society in general, but there's a lot of social unrest that's happening right now, a lot of fears. And the conversations that we have with our students and our staff members could look different at the high school, middle school, and elementary based on developmental level and understanding and what's happening and based on what city they're in and what's happening in their neighborhoods. We are worried. We're anxious. We know that students are coming back and staff members are coming back, and there's a lot of unrest. And we also know at the same time that routines, procedures, supports in place can really make the difference for our most vulnerable and provide that safety net for students who need short-term support.
Mrs. Oakes.
So one of the things that, for whatever reason, occurred to me for the first time tonight, I don't know why we've never asked this question. Do we have any data from the Utah High School Activities Association of rates of infection of high school athletes since they've started practices again? I'd be really interested. I know we've heard of a couple here and there in our own district, but how is that going? I mean, it seems like things are still marching and proceeding forward, which to me is encouraging because of the age group of those kids.
So I don't have the exact numbers from the Utah High School Association. Amber, I'm not sure if there is, but from our own district and talking with other districts, they've been practicing for a couple of months now, and the rates of exposure have been pretty minimal. There have been some isolated situations, and I anticipate that will continue. But what we've seen from some of these situations is just the peer pressure to make sure that they're social distancing because they want to practice. They don't want to quarantine. And if they're required to, right, then if they can make sure that they're doing that close contact exposure, just being mindful of that and practicing that, then that'll be helpful. But again, we've only seen a few cases in our county.
Any other questions for Mr. Weller? Mhm. No, we're going to finish this item and move the other items down. Yeah.
This is probably for you and the superintendent, but looking at, the positive tests and the protocols and the fears and the stresses, I really feel like I would like to ask the board to think about maybe the first day of school being more about getting the teachers together and going through some of those wellness steps mentally, emotionally, physically, and calming some of their fears. I mean, just listening to the physician tonight and listening to what he said about the layering and how much our chances are of not getting COVID if we just follow those three things and do the best we can. And so rather than having them figure out standards or figuring out how to do the grade book or whatever the heck we're doing for that prep day, that day, I think that it would be more beneficial to be able to have the teachers get together and say, what do we do about bathroom passes? Well, what do we do about if I'm in the portable and, the kids do have to go through my door and another door? What are we going to do about, the aids? There's a zillion of those questions, right, that everybody's been asking each other and talking about. But if the teachers had that first day to sit, and they're 6 feet apart and brainstorm, and even as teams go around and look at a room and say, how do I get more space here? I know we're planning on moving all the furniture out that we can possibly move out, which also then means academically, we're not going to be doing probably centers and bringing kids into small groups. And if they are, it's, for minutes at a time. And I could see myself just sitting on the floor, for a couple minutes, but there's other people who couldn't sit on a floor if they wanted to, maybe a chair, put them on the floor, the kids on the floor. But just for you and then the superintendent, I don't think
speaking my
we go-
language. I think that first week, absolutely, there needs to be training. And thinking of myself, when I have not had an opportunity to engage with decisions that have been made without my involvement, sometimes I struggle and I question. And in this situation where we've met with many staff members, but not every staff member. I mean, it's probably a small percentage of staff members, if we're honest. Allowing them to engage in that conversation at a more in-depth level will be helpful, not only for them, but I think for our schools, because they're going to identify things that we've overlooked, right? Being in the classroom in their space, being able to do that risk assessment. What does that look like? What can I move out of the way? How can I create more space? What does that look like?
It's going to be like the very first day that you ever taught, and you're trying to figure out how to do the sharpening of pencils and how to do the the storage of pencils and how to do the handing out of papers and how to get the collection of the papers.
Yeah,
But
we support starting on the 24th to give teachers that time. Every Friday, or sorry, not every Friday, by this Friday, our department will provide each school a folder of resources for principals on how to lead a circle or a debriefing with their faculty members and their staff, resources for teachers to talk to their kids when they come back. And it will be helpful for them to be able to look through that material and prepare and focus on the emotional well-being of our staff members and our students when they come back.
And with that one, the reason I'm bringing it up is because we all know if the teachers are not in a more comfortable position, kids feel what you feel.
Right.
They do. They will reflect what you reflect. And so if we don't get some more comfortable teachers in the situation that we're at, they're going to put kids into more stress. And so we need that to happen. So when those kids walk in, there's smiling faces, there's confident faces, we're going to have a great year face. I mean,
right.
Seriously. So it takes care of both.
I want them to also remember the stories of our students, right? Many of them have been living in unsafe situations, and it's more safe for them to be at school. We know that the domestic violence rates have increased drastically. We know that there have been homicides, even in our district. There have been some really tragic events that are happening, and it is safer for many of our kids in school. And so whatever we can do to figure that out, while figuring out again what that space looks like for us, that procedure, getting in that mind frame to be more comfortable. Whatever we can do to support, we're here, and whatever we can do, we gotta do it.
We're a team. We can figure it out.
We're a family, right?
Right. We are. And we can figure this out, and we can work together, and we can take on the challenge and make the best of it.
Yeah, absolutely. Are there any other questions for me?
Yeah.
while I'm
Other
here?
questions for BJ? Mr. Wrigley.
Yeah, I have just a really quick question. With all the civil unrest going on, is there some stuff we're going to do with our resource officers to help them get quickly in there and make sure their image stays as it always been, rather than what the news is portraying?
So we'll be doing some ongoing supports, but last last Thursday, we invited Dr. David Parker from the University of Utah to come and train our staff on what we call authentic inclusion. And our school resource officers were part of that training. And then they received a more in-depth workshop on that inclusion. And then we will have training specific with each of the 4 precincts in the next 2 weeks on back to school plans and supports.
Good. I'm glad to hear that. There's a lot of different portrayals on TV versus, and our resource officers have been very helpful in our schools and have been trusted to get all kinds of stuff from the kids. We want to have that continue. Thank you.
Absolutely. Thanks.
Anything else? Oh, thank you,
Okay, thank you
BJ,
so much.
Mr. Weller. Thank you. Next up, I believe, is Steve Diamond from our HR Director, Human Resource Director.
Thank you. To be able to present tonight, I've brought our team. Want to give them a great thank you for all their efforts getting us up and going this year, as well as our staff in our office, because it's been an incredibly busy summer to try to help facilitate. I truly hope I'm not doing policy update. There are. Thank you. So let me turn the time first to Kim.
Yes,
Thank
yes,
you.
that's better. I have some great news. We have had an exciting hiring year. We started mid-March, and we've hired approximately 177 licensed teachers. Excuse me, thank you. Licensed teachers to be in our wonderful district. And our administrators did an amazing job picking some great candidates. We do have a few open positions left. We have a 3rd grade, a 0.5 DLI French, English language arts, a student intervention teacher, 1 middle school science, a 0.5 diagnostic kindergarten, and 4 resource, special ed teachers. And so I think probably by the end of tonight, we might have 2 of those off that list. So we're excited about that. For the ESPs, we have since July, we have hired 15 ESP benefit eligible employees. The ESPs to be hired left, we have 13 more, and it's a variety of positions like IT, paraeducators, purchasing, custodial, and transportation. So we're still going full force there. We do have some resignation and retirements. Are licensed, and we've had teachers, about 22 teachers, and last year we had about 14. And this is from data from July 9th to July 30th, that we've had some resignations or retirements. And with the teachers, part of them, they were elementary, and part secondary. It's about even between the 2 there. Counselors about 2, and the ed techs about 1. The ESP, we've had benefit eligible, 5 of them. Resign, retire, about pretty normal, and only 2 mentioned COVID. For our teachers, the ones that did resign or retire, most of them did mention it was because of COVID, and about 23 hourly.
All right, so I have the topic that's on a lot of our minds right now, which is substitutes. And in a normal year, it's a concerning subject. And so you can imagine our concern this year as we are working to prepare for some extended leaves that may happen with our teachers. So we've started some recruiting efforts. One is our competitive wages. We've been able to offer a competitive salary of $108 to $129 a day, depending on the type of sub. We also offer stipends for long-term assignments that have different amounts. And we also have a stipend for our at-risk schools. So substitutes that choose to teach in our Title I schools get a little bit of a stipend there as well. We've also reached out in a blast email to 543 of our previous substitutes, encouraging them to reapply, helping them to understand the supports, the PPE, and all of those things that are in place in our schools so that they feel comfortable returning. And then we actually mailed a letter to 162 of our retired employees, inviting them to come back and support the district that they have supported, and encouraging them to come and join our sub team. We've posted advertisements of positions on multiple job boards. And then we're also encouraging our principals and community members, people within our principals communities to reach out. A lot of times we have a lot of people who like to volunteer in our schools regularly, and that is going to be limited. And so we're encouraging those people to turn their volunteerism into employment and come register as a sub and hopefully help their school. In the past, we have always had emergency substitutes available at each of the schools, and we're encouraging our schools to continue with that practice. Knowing that we will have an increased need for subs, our instructional supports department has supported us in postponing or canceling until fall recess, where we can reevaluate any professional development that's used during school hours. And so that in the past has used between 50 to 60 subs each day that there are scheduled professional developments. So that will hopefully help us to preserve those subs for those things. We've sent out a memo to all of our school administrators and head administrative assistants outlining our process for subs and for shortages of subs, so that hopefully they can feel prepared if there is an instance where there are some things, there are some classrooms that are not covered by our regular sub system. As you can see on the slide, the first point of requesting a sub is the educator requests it through our sub management system. If a sub is available and they accept that job, everything is great. If a regular sub is not available and there are jobs that are left unfilled, each school reaches out to their emergency substitute pool. And that pool is made up of community members, trusted members who are specific to that school that they can call for a day or a short-term assignment. And we've been very successful with having that be a good resource for our schools in the past, and we're hoping that that will continue. If an emergency sub is not available, we have authorized the use of internal employees that perhaps maybe only work a couple hours that day after their shift is completed, they can serve as the sub. Or if there is a chance that they can do a substitute duty instead of their regular duty, they're able to use those people in their school. Employees of their school can work as the sub for that day. And then if there's absolutely nothing available, then the school is going to contact our substitute office, and we've put some systems in place where we have specialists from our instructional supports department. We have district administrators. We have, people who are willing and able to go and provide that support to our schools. And we're putting in protocols for how that will work. And we just kind of need to identify what needs will be available before we have a clear process for that. But it is in place, and we do know that that will be a resource that we can use. Thank you.
So where are the instructional coaches if they were needed to be put in a classroom for a substitute? Because we have one or two of those right at every school.
So those would be a school employee that would be able to substitute for a class at the school.
Okay. All right. Thanks.
Other question I have with the plethora of stuff we have, are we going to be doing some additional training of the subs so they can know what they're going to be doing or should be doing, special due to COVID?
Yes. So as protocols are developed, we will be putting together information to the subs. We also want to provide them the PPE that our teachers are getting so that they have access to that. So we'll be developing protocols that our subs will have. And we also feel like giving them the information as we encourage them to sign up. We want them to understand that there are protocols in place and that they are an important part of that process. And with, school plans being, we have a district plan, but there are unique aspects to each school plan. So we're going to ask as they go to different schools that the offices are able to instruct them on school-specific procedures that they may need to be aware of.
Okay, yeah, I talked to the superintendent earlier just about instruction. Since so much of this is online, it would be nice if our instructional department was able to get with the subs that
Yes, absolutely.
doing worksheets and other makeshift stuff that sometimes we do with subs won't work very well when you're trying to keep kids separated in their chairs. So we hopefully, and especially if you have a teacher gone for 14 days, if we were able to use some of the curriculum we were using for online and whatever, and be able to get them into Canvas, it might be an alternative for our subs, which would mean we may have to teach our subs on Canvas, which may be something we should probably do anyway, since so much of the kids' stuff is on Canvas. And I teach in 2 school districts that haven't even given me an idea on Canvas, and I'm supposed to tell kids how to do some stuff.
be a
So
challenge.
anyway, thank you.
Thank you.
So I want to hit, let me take that one off. Yeah, exactly. Make it easier in that we have families that need to be able to see what we're saying. I'm not going to hit deep on the protective measures because Leon's going to spend more in-depth time on doing that, but I do want to emphasize some key points. One, I think, Clarine, you brought up a good point. It's fear is really driving a lot of this. And in doing so, I personally had 45 plus conversations with employees who are scared. They're scared to return. And many of them were quitting. They were done. They were going to walk away and say goodbye. And we've been able to go in and have a conversation with those individuals about this. And understanding and providing information to them has been critical in having them feel safe to return in an environment that they're not going to have that exposure take place, that it's being sanitized. They're being provided tools. They're being provided face shields and masks and gloves and other things that they need. That's a critical piece for this understanding. And so today we're sending that information out to everyone. So we went out to the principals and the supervisors, directors today. That will again be going out to the employees shortly, probably tomorrow. That provides them a direct talking points, not only for themselves, but also for the parents, their students. What are we doing to provide that protection? And it's a little simple 2-sheet, and I believe you've already received those as well. So we're going to be providing a lot of equipment to those individuals. Leon will go through all of that piece of it. We also have the FFCRA. So if we do have a quarantine situation, we have a protection for our employees. That's going to be a piece too, is that they're not going to be using their leave. And so that will be a critical piece, is the PPE. And then we're going to have individual needs that are outside of this list, right? We're going to have individuals who need additional, and we're engaging in this protective measure conversation with each individual. It's a case-by-case basis. HR is working with that. I work individually with that person. We find solutions. We aren't at the spacesuit level yet, but we definitely have been creative in finding solutions so that someone can feel comfortable in doing their job. And that's part of our role too, is to be able to provide that support to the individuals. Thank you.
Just a question with you.
Absolutely.
If in fact we have, I've talked with some teachers and they've talked with their principals and they didn't feel that it met their answer or whatever, can we go to HR to ask for additional support in these areas? Because the money's going to come for you, probably wouldn't come from the principal.
I would actually
I don't want
ask
them
them
to
to call me
jump over
directly.
their line of command or whatever, but I think we need to have it where somebody really has a concern and wants to address that specific thing. They may be the only person with a specific disability or specific disease. Maybe go to HR and talk with them about how we can do an accommodation would be appropriate. Or
I would go one farther. I would actually tell them to call Everett Perry in Human Resources. I've become this COVID thing. I don't know what it's become. I laugh because in 92, I took my health education courses and one of them was on epidemiology. And I'm laughing as I'm never going to use that again. And now we do. But I actually would ask them to call me. Is directly. Anyone in the school district that's having those concerns comes directly to me. And that's part of my role, is to be able to provide that education support and those protective measures. We can accommodate those to make it happen.
yeah, I
So
don't
yes.
want our teachers to feel that we're going to put them in harm's way without that support.
Correct.
But we need to maybe brainstorm it, particularly for that particular teacher, and to just say, well, I'll just leave the profession. We lose a lot of, when that happens, especially if we're talking maybe a semester or two, and then we may go back to somewhat of normal or in the new normal.
We hope so.
But anyway, I mean, I would hate to have that happen just because of that short period of time. So I'm glad to hear you're a resource. And we do really need to encourage the teachers that if they feel at the local level they're not getting what they need, please go up to the district level and we can see what we can custom for them, even if it is a space suit, I guess. Some of the younger kids would love it if a teacher walked around in a space suit.
I mean, of the 45 people I've talked to, I would dare to say 40 were ready to leave. They were done. They basically said, I don't feel safe coming back. I'm not going to be there. I've had 2 quit. So we were able to talk through that. And I think information is powerful, right? We need to provide that information and we're doing that. It's just, we didn't even know some of the information until yesterday. So we're gaining that information. And the moment we gain it, we need to make sure we're providing that to employees and the employees providing it to the parents, the students, and the staff so that we're all communicating. And I think when you provide the stuff that you're seeing Leon will bring up, you're going to go, yeah, we do have a comprehensive plan. And you're right. We're going to have gaps and we're going to adapt very quickly to that. And I think Canyons has had a reputation of adapting very quickly and innovatively to solve these kind of issues. We're going to continue to do that.
Thank you. I think Mrs. Oakes has a question.
Please.
Thanks so much for your presentation. And for the record, I just want to make it really clear that I recognize that the district is constantly evolving its plan, and it's improved so much from the first time it was presented to us. And so I recognize that and I appreciate that. One of the questions that has come up in some of the emails is regarding the air filtration system and how that will impact air conditioning in the classrooms. Can you speak to that a little bit?
Actually, Leon's going to spend some time on that, but I know we are going to be increasing it to HEPA filtration, at least MERV 8 factor. So it is going to help improve that circulation. We're also running the fans more often so that the air movement is a critical piece to this, right? We know from our epidemiologists that air movement is important. We've got to get that air circulation to pull those droplets back out of the air. And that's why we've also moved to the filtration. Leon will be addressing that issue.
Any other questions? Thank you.
And we talk about Mr. Perry. I call him our MacGyver because it is amazing how he can problem solve a situation and look for solutions for people to help support them. So when he says, call me, he truly means it. And he looks at lots of different ways. Talking a little bit about moving forward and what's happening with our employees who have identified themselves as high risk. We have 252 educators who applied for the online teaching. Out of those 252, 85 were identified as individuals considered high risk. Beginning this week, tomorrow we're meeting with elementary principals. Thursday is middle school principals. Friday is high school principals. We are meeting together and doing a massive problem solve because this is like a puzzle like none other that I have ever seen. Elementary is simpler than middle school and high school. High school, when you get into all of these course offerings and sections, it is phenomenal. But what we will be doing, so we're anticipating right now, based upon the enrollments that have come through, for elementary, approximately 61 teachers teaching online. From elementary, there were 73 teachers who had applied for elementary. 27 of those were high risk. We will go through every single school, looking to see what we can do, how many people we can accommodate, so that it may be that one school, you have a teacher from all of the grades who are teaching online and then picking up other students from other schools. There are so many different combinations, and we recognize that one person can't make all the decisions. So by bringing all of these principles together, instructional supports, human resource, and school performance, working together, we believe that we can put together the best, that we can support our teachers and our students the very best we can. Is it going to be perfect? No. I'm just going to say it right out front. But we will do the very best we can, and it's going to depend on lots of different factors. Similar to how many online requests, how many, right now, the high school principals are trying to figure out what are all those different courses. In the middle school, you've got math, science, English, and math 7. It makes it a little bit easier, still difficult. So looking at school needs, class sizes, qualifications. It's kind of hard to have a PE teacher teach physics and a math teacher teach language arts if they're not qualified to teach in that subject. So our goal is to do the very best we can. Also the high-risk conditions, looking at those people straight up front. What can we do to try to help these individuals? And I can relate to them. My wife can relate to them. I'm identified in 2 areas as a high-risk individual. My wife is a nurse. She's also high risk. She goes out to the tent and tests for COVID at least once a week. We practice personal responsibility. I have procedures in place. When I go out to my car, I open my car door, I take off my mask. I have a hand sanitizer in the car door. I sanitize before I ever climb in my vehicle. When I get home, I also sanitize again. My wife has other procedures of where she changes the minute she walks into the house. So there is personal responsibility with this, and you can be safe. You can't eliminate every single issue. The same thing when I climb into a car, My goal is to drive here safe. And I expect people around me to also follow those procedures, to stop at stop signs, to follow the speed limit. And by doing so, we can protect ourselves. And it's the same thing with our community. If we're wearing masks, if our students are doing what they're supposed to, if we do appropriate social distancing, hand sanitize, wash your, not touch your face. I'm still working on that one because I like to touch my face occasionally. So working on that. So we'll be working together to try and come up with that. So Wednesday, elementary, I'm hoping that by the end of that day, that principals can go back and talk to their teachers and say, okay, this is what we're going to be doing. On Thursday, hoping the middle school principals will be able to. It may take a little bit longer, especially if you've ever built a board and trying to figure out all of the different pieces. It takes an incredible amount of effort. It's like I mentioned to the administrators earlier this week of a Spider-Man puzzle that my family put together. 500 pieces, itty bitty teeny little pieces, and the colors are so close that the only thing that you could do is to look at the shape and try and match the shape. It took us 3 days to complete. This is similar to that. It is going to be exceptionally difficult, but I know that our principals and our staff will do everything that they can to help provide the best supports that we can for our high-risk employees. And we're really trying to, everything that we're putting in place are risk measures for all employees as if everyone were high risk. We want everybody to be safe, and we want our students to get the best education possible.
Great. Mr. Wrigley?
Yeah, I have a question. So we've talked a lot about teachers, but, and when I read our report, it talks a lot about physically present. What do we do with the high-risk people that are actually, for example, our counselors, our psychologists, our plumbers or whatever, what do we do in those cases, especially counselors, psychologists, people, nurses? What are we doing in regards to that population?
For plumbers, our facilities folks, we've got our things already in place. We've got the masks, we've got gloves, depending upon what they do. The problem is that it's for teachers, and we're coming up with online options for as many people as we can. A plumber has to be present to be able to fix the plumbing, air conditioning, our HVAC folks. But we are working to try to help them follow those protocols, the social distancing, the masks. Everybody is following it. And at the very beginning, people were struggling with understanding why. And we have helped employees. We have a little teeny, I don't have it with me at the moment. I have little sacks that I carry around that says reminder, we all need to be wearing a mask. So rather than confronting someone, I just walk up to them and hand that and say, do you need a mask? We do this, it's part of our district procedures, but it's also to protect all of us. And I haven't had one person in the district who has been upset with that.
Well, it seems like most of people should be able to keep the 6 feet distance. I mean, maybe some of the school secretaries may have some issues, but they may have to check is that you're the one that deal with the kids with COVID and not EMI or something, separate that a little bit.
We've put in plexiglass shields. So if you were to come into HR, we were the first ones to really reopen, and we've had plexiglass shields in place, social distancing. We have protocols that when somebody approaches us, we put on our masks. So if we're by ourselves in our office, if somebody approaches coming to my office, I put on the mask immediately as soon as someone comes. So we've tried to help instill that in all of our employees.
Okay, thank you.
Okay.
Any other questions for our HR department?
Just thank you so much for all of the incredible work that you folks are doing, because it is not an easy task. So thank you.
So
Thank you.
I had one more.
Yeah.
So somebody wrote me an email and asked me about if they're brand new, and this is kind of a little bit off, but still on the same topic. If they're brand new and they're getting their 10 or 14 days sick days, and they get caught up in the quarantine, and they get quarantined for 14, and they're over their sick days they had. Can you review with us what we've decided to do with that? Because I've forgotten, and or it's mixed up with something else in my brain.
No
So
problem.
that-
Happy to do so. Okay, so if it is, there's the FFCRA leave, which is basically 10 days of paid leave up to 80 hours that as long as you've worked for 30 days, you qualify for. We can get people to that by using their own leave. The other piece that we've added is in the policy, it talks about personal leave that you can't use more than 5 days in any year. If they are excluded by a health department, in our policy, it talks about that you can exceed those 5 days. So you'd still use what you have, but so for like myself, I've got 45 personal leave days that I haven't used over the last, 30 plus years. And I know a lot of educators who are in that situation. So we can get them by using their own leave, their personal leave, maybe non-paid, hopefully not, but then get them to the point of, because those 30 days are calendar days, they're not work days. So you're really looking at approximately 20 days, and we can get them through and get them to the FFCRA leave that is paid. And so there are the 6 conditions. We've sent all that information out. As we train people on COVID, we have a module that's also going out to all employees, talking about that FFCRA leave, because it's all employees. Could be our hourly sweepers. It could be our folks who are substituting. As long as they've worked for 30 days, we have that leave available for them.
Thank you.
Thank you. Have a wonderful evening.
Thank you. Okay, next, I believe Mr. Leon Wilcox, the business administrator.
Oh, sorry. You just switched over. You just got to go back just like that. Yeah, that's the right one. We'll go quickly over this because I know we're running a little bit behind. We'll just talk about registration and then some PPE items coming back. Again, these are our registration numbers as of this morning about 9 o'clock. We have a roughly 86% completed, with about close to 14 who have not, 2 who are in the process. 2% are in the process. About 12 have not started. You can see the completed totals out of that 29,560. About 77% will come back to, or have said they will come back to us in person. 21% online, and 1.8% parent led. It is important to realize that this is not distributed evenly across the district, okay? Just for instance, now the totals, the type is fairly close. Our high schools, for instance, are about 76% on coming back in person, and about 23% online. However, our middle schools are about 79 in person, so they're a little bit higher. I'm thinking mom and dad don't want a 13-year-old at home. With a little bit, and our elementaries are about that same total as well. However, so they're kind of in that same range. The bigger discrepancy is throughout the district. Let me just start with the high schools, and the schools that feed up to them are basically in that same category. We have Brighton and Alta are about 79% coming back in person. Corner Canyon's about 86%. However, Hillcrest is about 66% and Jordan is about 70%. So they're considerably lower than these other schools. And I would say, and looking at the middle schools, those schools that feed into these are roughly in that same range. So, so for instance, Midville Middle is about 64% online. Draper Park is about 84%. I mean, in person, okay? Draper Park is about 84% in person. So there's quite a range there between in person and online throughout the, the various areas of the district. We're not sure exactly why all that is, but that is the case right now. Okay. Let's just go over some PPE, and we can pull we have a dashboard. We can pull all kinds of reports off this. We just gave you this as a snapshot. We can pull all kinds of by school and by however you want it pulled, if you want some information.
Leon, I just have a quick question, and maybe you said it and I missed it. For the completion rate of registration, you said that's pretty even across the district?
No, I would say, yeah, the completion rate's pretty even.
The completion
A
rate.
little bit higher in Midville areas, probably a little bit lower, but the completion rate's fairly, yeah. So we still have 4,000. That is we are trending a little bit below past years. We never do get 100% by day one. Okay, so but we know there's still parents out there deciding what they want to do. We want to talk about probably the two biggest things here is that hand sanitizer and face coverings. As Dr. Webb said, the best two things seem to be washing, good hand hygiene, and also wearing a mask. So let's talk hand sanitizer. Every school, every high school classroom, we have about 850. We'll have a large gallon hand pump of sanitizer. We have 1,000 of those. We got another 1,000 coming here shortly. So they will be swapped out. Every one of our elementary schools, every one of our elementary classrooms will receive 2 to 3 of these hand sanitizer for the younger students. They will be refilled nightly by our sweepers. We also have about 400 dispensers throughout the buildings in what we call our high traffic areas, cafeterias, offices, whatnot. And then come October, we're hoping to get hand wall dispensers in every classroom. We have 10,000 refillable bags, so they will go in every classroom that way.
Before you move on with that, I do have a couple of questions. Those 8-ounce dispensers. I have 28 kids, so how many times, how many squirts are we going to get out of that?
We'll have a couple in each classroom.
Okay.
And we can refill those easy because we got the bags there.
Okay, so does the teacher send it with the student up to get it refilled, or does the custodian have to come down and refill it, or?
We'll have the custodians refill. We plan to do it every night just to make sure they're full every night.
And you'll think that'll get through the day for an elementary student?
think so.
I mean, an elementary
Yeah.
teacher?
I think they'll come close, yeah.
Okay, then the other one I thought about was I just read an article about how the hand sanitizers are being recalled because of the wood alcohol. And I know that ours is safe and that we ordered because we would have ordered it under OSHA, right? And the OSHA guidelines. But what are we going to do about students who are bringing it to school with them in their purses that fall under the not safe kind that they can drink and use for other recreational purposes? Serious way.
For some of us, in the district office, it's been some pretty late nights and a lot of stress getting this organized. So we have ordered the wood alcohol here.
Okay.
But that being said, obviously we did see that. We have ordered the proper, approved materials from the CDC. It has to have that 70%. Some of those claimed they didn't. We're 62%. So we want to we've made sure that ours, meets the guidelines. People who bring it in from home, we will have to, I think that's going to be more of a BJ question on positive supports type thing on bringing stuff into the school. So I don't know how
So does that fall under the cough drop rule? I'm wondering, I'm just wondering what we're doing with it.
Yeah. So I,
It's too late at night, BJ. Never. I'm sure you're working on it, right?
So I think it just depends. And if they send it, just work with the teacher. If it's hazardous, our teachers will need to be aware and ask them to leave it at the office. We'll need to do some more educating our parents to let them know what they can and can't send. But
Okay.
we don't want to make it a huge battle.
Okay,
But
thank
we
you.
want it to be safe.
Okay.
Leon, are we going to do any you got the hand sanitizers tonight, but that dries the heck out of your hands. Are we having any kind of hand lotion or anything in case the teachers notice that the kids' hands are getting all dried out?
I think that's more of a thing at home. We don't have any, our intention is not.
Okay, we're hand sanitizing it, but even when I use it, that alcohol after a while, it
It
just
does
starts
dry your
drying
hands,
out your
yeah, it
hands.
does
And
dry your hands.
so we may want to encourage the parents to
That would probably be.
have their kids bring hand lotion or something.
Mrs. Schill.
So I have had some parents tell me that our hand soap is really drying. So, I mean, I am a little worried about that when we're going to have kids washing their hands all the time. I mean, I don't know. I mean, have we changed? The soap is
Oh, the
very
soap.
harsh. So I don't know. I mean, are we just getting the same kind of soap?
I think we're going to get the same.
Okay.
yeah.
So we just need to encourage parents to bring lotion. Send lotion with our kids.
But there's also issues with hand lotions too, because we have kids who have asthma, and those perfumes will offset kids' asthma, because that's happened in my classroom before. So like everything has a trickle down effect, so we need to be cautious of that too.
We're going to face coverings now. Every employee, we plan to give them at least 2 cloth masks. We got about 40,000 of these from the state, one I'm wearing tonight. So they will get 2 of these of the Utah ones. We've ordered cloth masks for all our students. We hope they should be here by the 24th, assuming we go by that date. If not, we still expect them to bring one from home. We will be providing paper masks. We have 50,000 of these paper masks we'll have those available as well for students who may forget one or need an extra one. We know we will each have a box of these in every bus for when students get on, so they'll be able to do that. We know from what Dr. Webb says that, me wearing a mask protects you, you wearing a mask protects me. So that's going to be somewhat of our motto, and we're going to make sure we have, proper face coverings. We also look at these gaiters that people wear too. We plan on getting about 15,000 of those for our students too. So they'll have a little bit of an option there. We have face shields. We know they're not as effective. We do have 4,000 of these in stock for our teachers. We know that recently it came out with a study that they should, I'll put this one on. They should go down below your chin. This one does not quite do that. So we'll have to look at next ones, okay? But we will be getting other ones. We plan on providing each certified employee with a face shield if they would like. We also have lots of plexiglass coming on order, expected here to be on here on the 10th that we will be getting out. We have lots out already, but we still will be getting more of that out. Each classroom we have 26,000 packages of these disinfectant wipes. We'll be giving each classroom 2. They can reorder those as necessary. We made a large order. We may have to look at making another large order, okay, of these. Again, we have 26,000. That's a lot of wipes, but we have a lot to clean. And each classroom will be getting what we call a peroxide bottle with a couple of these micro cloths to clean. So, the teacher can just go down and squirt. You don't even actually have to wipe it off, but you can as well. I think this will probably be a little bit easier than the wipes, but both options will be made available. These can be refilled by our custodians We have what we call a flow system. They can refill these in the school. We may not have enough bottles for the first day of school. We think we will, but a couple classrooms may have to share a bottle of this going to start the school off. But if not by the first day, shortly thereafter, we'll have one in every classroom. Again, they will be refilled. They can be refilled by the custodians.
So are they using it like before school, middle school, after school, when?
We're going to leave them with the teacher. She or he can clean. Between classes, if it's in a middle school, at lunch, if it's an elementary, we're going to give some flexibility and a freedom to that. We just want to make sure the resources are available to them.
Okay.
Then we will be doing the cleaning after school, of course, but this is during school.
So I was at a conference and they used that, and I noticed a couple of the ladies were having problems with the fumes from it. So I'm not sure if it's exact same thing, but thinking between kids being there and not while kids are being there, maybe.
Well, the kids can be there. This is safe.
Okay.
We certainly wouldn't allow teachers to use this product if it wasn't safe for kids while they were there.
Okay.
Going on to drinking fountains, we do intend to leave all the drinking fountains on. We are going to encourage students to bring a refillable bottle from home. By the start of school, we will have one. See, I just touched everybody saw me touch my face, and I shouldn't do that. By the start of school, we will have one refillable station in every one of our buildings. Our standard will be to get 2 in every elementary, 3 in the middle schools, and 4 in the high schools. Some will exceed that. We have about 50 on order, and we may not get those back here until 2 to 3 weeks after school starts. But we will have one station in every school, so the teachers may have to coordinate efforts to go down and have those filled at various times. Let's talk about ventilation and filters. We will be running the fans longer at each elementary, at each building. They will run from 5 till 8 to move. That should be 8 p.m. I'm sorry, not 8 a.m. We'll run them longer than that. Secondary fans will run from 5 until about midnight. We can turn off the chillers and the heat when we get to the winter months. So we won't necessarily run those, but this will move the air, and that's what we'll be looking at there. Each school has what they call a MERV 8 filter. That's the recommended standard. They'll be changed out on a quarterly basis, which is a little bit quicker than they are now. They do have what they call a MERV 13 filter, which is a thinner filter, catches more particles, but we have to change those out more. We will be looking at those in a few of our buildings. Not all buildings can accommodate that type of a filter if you don't have a central system. So that's the problem with that. But going back, this is one of the problems that we just naturally have. And that is, if you take out, we have 29 elementaries. If you take out the 4 ones that we've built, Altaview, Butler, Midville, and now the new one, Mid-Valley, our average elementary school building is 46 years old, built in 1974, okay? And so that's part of and they're smaller buildings. That makes it a little difficult for the social distancing. And that's also impacts the mitigation. Like I said, like everyone up here has said, we're doing everything we can to mitigate, but we certainly cannot guarantee that we will be able to correct everything. And so that's part of the infrastructure that we have. Additional labor, we are going to use some of our care funds and we also got a grant from Salt Lake County. We're going to increase our sweepers hours by 25% to do the at-night cleaning. The issue is we are having some parental concerns about their kids working as sweepers, and so even if we raise that wage, we just don't think we're going to get them. It's just that overall concern about that. We will also be adding with that money this year some additional rovers, mainly to help in the elementary cleaning buildings and changing out these filters, as we said, on a regular basis. Right now, we have 2 unfilled custodial positions. That's a little bit better than typical. Usually we're in that 4 to 6 range.
Can we have a little conversation about that? I'm thinking about the custodians and how now we have to fill those bottles, and now we have to fill those bottles, and then we have to clean up any kind of throw up or diarrhea, and we have to clean the bathrooms when the kids are on recesses. And then we have lunches, and most of the custodians are usually tied up in the lunch hours in the lunchroom, and especially now because they're going to have to really make sure. I mean, we do have lunch ladies cleaning tables, but we still have to make sure that everything's pretty sanitized. And I know you put it down as, you know, having sweepers come, but if the sweepers, we can't get them because of parent concerns. I'm wondering if we had somebody come in for those hours in the middle of the day that could do even cleaning of the bathrooms or do the filling of all the bottles and the cleaning of the bathrooms during lunches, while the custodians in the lunchroom trying to keep track of all that lunchroom thing that goes on versus the sweepers. And I didn't know if that was something we as a board could discuss or something that we can't discuss.
Obviously, you can discuss
Anything we want to discuss?
You are, of course. One of the things that 400,000, we're just not going to say nighttime sweepers. What we're looking at doing is precisely that. Instead of maybe bringing back in, look at maybe a 5-hour person, you know, non-benefited coming in the daytime. So they'd be paid at a different wage than a nighttime sweeper, but they would still be there
During the day,
in the day.
during those times? Okay, because that's what I was kind of like hoping for, like even if
Yeah.
they're from there from 10 until 2 during the day,
Summer.
so they could be doing the bathrooms and the playgrounds and the whatever while the,
One of the things that's also important to remember, at least starting off, we know our billings will be about 25% less based on our registration numbers. So there won't be as much cafeteria type cleaning and things of that nature because we'll have fewer kids in the building. We also may focus more on disinfecting and sanitizing than we will see on vacuuming. So vacuuming may not happen. Probably won't happen every day in our schools. So we'll put more efforts to these cleaning things here. Yeah.
Okay.
But obviously we'll take your direction, however you want us to do, but we're thinking that.
so is that something we need to discuss and decide if we want the money put into sweepers or into a daytime person to be there for a few hours? Or you're,
I think we can, as administration, I think we can handle that.
decision?
I think we can make that work.
Okay.
And it may be different at each school. At the secondary schools, they have 9 custodians total, 9 in our high schools, 4 in our middle schools. I think they're going to be okay staffing wise there. It's more of the elementaries that we were looking at adding this support in the middle.
Okay.
Of the day.
Yeah. Yeah. So it sounds to me like maybe the board gives you direction to make sure that there are custodial supports there so that a lot of that those tasks don't fall onto the teachers who are doing other things. Right? Is that what you're thinking of?
I can
So
step
that
on
it
my
happens
part.
without
Well,
a teacher having to step up and do
Right,
it
a
when it's not part of
combination.
their,
I can probably address
their
that easier.
job.
Kevin Kelson and I have been working already on a plan for the $400,000. We're going to be posting positions here shortly. We have the 5-hour and 4-hour midday shifts that we're already doing. We have a la cartes that are in many of our elementary schools already. So we have additional custodial support that's in the cafeteria specifically. And then on top of that, we're actually going to be hiring part-timers during the day for elementary schools. So that's already going into place, and we'll be posting those probably at the end of the week. So we're already moving forward with the plan to do that. That's in place because we realize that the custodian can't do it all, right? They're the miracle worker. I got that. And they really are. But to be able to do the refills, to keep the sanitizing and the other issues and, pulling out the protectus and sanitizing, we're on that. And so just please know, we already have a plan in place and we are going to move forward with hiring those. And yes, the public's watching. We'd love to hear from you.
Yeah, well, I was just wondering because it looked like it was going to go only to sweepers. And my concern was that then we didn't have enough sweepers, but then that one person at that elementary is trying to do.
Correct. And we
All
call it
those
sweeper
tasks.
budget because it's our part-time budget.
Okay.
So really is a part-time custodial, which we traditionally have not had. Now we're going to be doing part-time custodians during the day.
Okay, thank you. That
very welcome.
clarifies that a lot because I was just thinking it would be somebody at night again. Okay.
And then we have, I think if some of you have been in our floors lately, we have markings going back and forth. There's a couple examples of a couple different schools. I know McKay put some in his as well. So we've tried to do some of that. We will be continuing to move that forward there. So with that, that's all I have. Is there any questions?
Any questions, board? Great job. Thanks, Leon. Okay, I think next up is School Performance Department. Alice Peck, I guess we'll turn the time over to you.
Okay, we're going to talk a little bit about volunteers in CSD as we reopen school. And just want to point out that our volunteers are a very integral part of our educational community, and we rely on and appreciate the partnership that we have with all of them. And so we really do want our volunteers to be back in our schools just as quickly as possible. But we also want to make sure that we can do that in tandem with the school reopening plans that we have in place. So our elementary, I'm going to break this down into 3 different groups: elementary, middle, high school. And our elementary schools in general are waiting for 1 to 2 weeks before having volunteers back in their buildings. After that, they're going to closely monitor volunteers. And it's important to note that they're going to be looking at limiting most of the volunteers to essential volunteers, and they will reassess that on an ongoing basis. And when we talk about essential, each of our schools will work with their teachers and their staff to determine essential volunteers that are needed school-wide. And they want to certainly have a consistent approach, knowing that certain classrooms and teachers might need or have different needs for volunteers. So some of those situations will be unique. They'll also work with their SCCs and their BLTs and just everyone else that is involved in bringing our volunteers into the school to make sure that we have a consistent plan. Our middle schools are closely monitoring their volunteers in the building as well. Again, looking at those essential volunteers and reassessing that on an ongoing basis. High schools are also closely monitoring their volunteers in the building and limiting them to essential. And they're looking to do that until Labor Day. But I think it's important to note that our coaches and our activity boosters, they also have volunteers that help support their teams and groups through fundraisers. So they will continue to work with the coaches and other administrators just to make sure that they're following the safety protocol and all of those different pieces are in place for the needs that they have at each individual high school. Just to touch briefly on what all levels of volunteers will be required, they're going to be wearing face coverings, answering a health checklist question, temperatures checked before entering buildings, and all of our school principals have been asked to work with our PTAs in creative ways in terms of volunteering their time. So we're looking at ways for them to volunteer both virtually and in person, and looking creatively at fundraising options. Now with Title I and community partners, our Title I schools and family learning centers, they are right now, those volunteers are going to be limited to this fall semester, and they're going to look at what the needs are specifically. But our family learning centers will be working at home to support teachers' requests with materials they may need to support the classroom. They'll also be helping other parents in the school through online communities and small groups. Our Parents as Teachers program, they will not be having home visits this fall, but they will, the staff will be working with individual parents and students online to support that program. Our Title VI Community Navajo Language class is on hold for now. After school programs will right now consist of our CSD staff only, but we will certainly be looking at need and reevaluating what is necessary in terms of volunteers and how they can be aligned with the school staff needs. Our Midvale Middle program begins mid-September, and right now their volunteers are on hold. And our secondary recovery programs, after school, snacks, kid care, dinners, all of those things right now are going to be run by staff. So we won't start with volunteers, but certainly that will be reevaluated as needed. United Way of Caring right now is going to be canceled for this fall. We're relooking at ways to do some of the things we've done in the past with other community partner events like our Utah Food Bank, immunization clinics, eye cares for kids, all of those things. Those dates are going to be set tentatively and will be reevaluated as we get the school year going. So lots of things that will continue in terms of volunteering, but may or may not look the way they have traditionally in the first week or two of school. Our school performance department asked our principals to get feedback from PTA presidents in terms of what it is that they feel that PTA needs to be successful this year. We also got input on how comfortable they are with volunteering and asking them to help us with creative ways for volunteering in person and virtually. And again, looking at fundraiser options so we can be creative. But again, I think it's important to note that the message from our principals to our PTA and certainly from our district as a whole is that PTA, our volunteers, they are a very valuable part of our school community. We want and need their support. I think what most of our elementary schools are just asking for a week or two to kind of acclimate to their new normal so that they can safely mitigate risk and get those volunteers into the school as soon as possible. Are there any questions?
Mrs. Oaks.
So I understand that Susan Edwards is the volunteer coordinator. So one of my questions is with regard to what numbers we've had with registration so far with volunteers in the district. I don't know if we have that collected yet. And also what the response has been from the respective PTAs about what we've put out there. Can you speak to that maybe?
I'll let Susan come up.
Sorry, what was the second part to your question?
I know that the principals have, reached out to the PTA and asked questions about it. It sounds like that. What do they need to be successful? I'm just curious whether or not we've had response from the PTA and what the feedback is.
So on the numbers, we are at about 4,400, which is about 37% of our end. Usually by the beginning of school, we're up to give or take about 8,000. So we're running a little behind. But I think probably with the unknowns and people figuring out their children's education, they're yet to figure out, how they volunteer, what that looks like, and also without us really pushing out and putting out the need. I think like Alice said, we'll give it those few weeks to get acclimated and get this ship rolling, right? And then hopefully we can engage with the volunteers a little bit more and know what that looks like a little bit better. On the PTA, the principals have had that communication so far. I was copied on some of those answers and have seen some of them, some great idea generation from some of the principals with their PTA. Again, some confusion, some consternation over how do we do this? What does it look like? We train the PTA, the region has their training on Thursday, and part of the principal input is to get some questions from them on what it can look like and things that we can help them brainstorm. How do they do some of their programs this year? How do they do reflections? How do they do Red Ribbon Week? How do they incorporate online students? And so we'll be brainstorming with them and helping them try to problem solve how to do some of the things. Obviously, from a PTA perspective, one of their greatest challenges is going to be their membership. All their membership drives usually happen at back to school, and that's not able to happen this year. So they're just trying to figure those things out. So we're trying to work with them still a little bit in its early stages, but we're still starting to work with them. Thank you.
Were there any other questions around volunteers?
Any other questions? Oh,
Okay, we're going to move now to school-specific reopening plans.
great. Thank you. Thank you, Alice and McKay Robinson. Dr. Robinson will take over.
Well, here we are again, and it's great to be back with you and take just a moment here to discuss the school-specific plans and everything that our amazing principals have been tirelessly working on with the support and help of their school community councils and building leadership teams. So as a quick little summary for those of you that are viewing and listening in, to kind of give you a background and an understanding as to how this all came about. Our schools have developed their plans, as I just mentioned, with their school community councils and their building leadership teams. And in that process, they were asked to simply refer to the 7 characteristics of a situation that was outlined and have been outlined by the Levitt partners. And that was something that was presented to us with the state superintendent, as well as the superintendents and districts throughout the state. And the characteristics are listed there before you, and I'm going to walk through each one and kind of give some of the examples that our schools what they have done to address these specific characteristics. And I've kind of find myself in a very much easier presentation at this point, due to the fact that all of my colleagues have answered so many of these questions already. So it really makes this quite simple. But those plans were submitted to us for approval. We've been through each one of them with a fine-tooth comb, and they were then provided to you for any sort of review. And then on August 1st, as Dr. Robbins had mentioned, they were posted to their school websites. And so anyone that may be unfamiliar with their specific school plan, we would strongly encourage you to go to the school website to look at those specific plans. As Dr. Webb had mentioned, there's obviously going to be some flexibility. We can't plan for every specific scenario and situation. Even as you had mentioned, Clarine, with having teachers have that opportunity to discuss those a little bit further. That's what we are strongly encouraging, and we anticipate those plans growing and strengthening as the time goes on as well, just as our district plan has done over these last few weeks. And we obviously, they have followed the plan that was approved by our board, and then we are addressing all the different specific areas. And then the implementation of the plan will be monitored by our team and the building administration. So starting with those 7 characteristics, the very first one that is mentioned is movement. And the question that our administrators should be asking, and those that are involved in the process, and even the teachers now when they walk into their individual classrooms, are just how are we moving around in this specific space? And the way that the Levitt partners have described it for us is that the directed movements, or even the assigned seating, can limit the risk, if you will, whereas undirected movement obviously increases the risk. And so there are a few pictures there that you can see, and Leon had pointed out some as well. But these are some examples of what's happening within the schools to address this very issue. There are single-sided hallways walking down. There's arrows illustrating things. Our teachers have done a tremendous job over the last few days at Corner Canyon High School following this very thing, even practicing themselves. But I was in contact with one principal today that, if you notice on the right-hand picture, there are some little round dots that they have spaced out as well for if they are stuck in the hallway for a moment of standing in line or whatever the case may be. She placed 380 plus of those dots in her building today alone. So these things are ongoing, and they are continuing to ask these questions of how can we mitigate risk through with providing directed movement. Because as Dr. Webb had pointed out, and several of my colleagues have as well, this all comes down to the layering component. There is not one of these that will eliminate all risks, and so it's all about the layering process. The next piece is the duration. I believe it was BJ that talked about this, but this really comes down to how long are we in a specific space. And we are hoping for and trying to create situations where they are in 15 minutes or less, in the sense of not allowing for congregation to take place. And so some of the different things that will take, like a small group instruction. Clarine, you had mentioned sitting on the floor and having those times being shortened. That is one specific example that some of our elementary schools are doing. In the middle schools and high schools, they've even looked at and are talking about the shortening of the transition times between classes, just to eliminate the possibility of the congregating. So it's literally a class ends, get to your locker, get your next, whatever you need, and off to the next place. And
So a question with that one.
please.
I would think that we would make it longer so teachers had time to clean off the desks, so the kids had time to clean off the desks.
You bet.
Why would we shorten it so then they don't have the time to clean off the desks?
So what I'm referring to there is the specific time where the bell has rung to transition to your next class period. They're building that into the schedule of their class period to mitigate the risk with the cleaning component if they choose to do it at that time with the students in the classroom. So it's just the matter of the student themselves moving from class to class. That itself is being shortened a little bit.
Okay.
And that's just an example of what some schools are doing.
Spending 2 minutes at the end of the class to do that versus, okay. All right. I just wanted to clarify.
Nancy, can I say something?
Yes, Mrs. Oakes.
So yeah, I have a question specifically on point with that. So for instance, Draper Park Middle, the parents fought for a long time to be able to even get one additional minute in between periods, because a lot of the kids were complaining about the fact that he never had time to even go to the bathroom.
Sure.
So I'm like looking at those lanes thinking, in high school, do they need a little bit more time to make sure they are socially distant and to be able to take care of their needs? I don't know. I mean, I see it as a parent of having middle schoolers come home and complain about that issue.
Sure. As would I if I needed to use the restroom as well. But honestly, what you are noticing as well is it's very similar to our district plans. They strengthen as we go along. And there are going to be things that look really great on paper right now. And once they are implemented and we have, as Dr. Webb mentioned, once the kids are there and we're seeing what's happening, we're flexible and we are going to make adjustments as necessary. So the plan right now is to, in some schools, to shorten that time, but that may go right back to how it was, or even it may be necessary to even lengthen that depending on the situation. So. And then proximity, here are a few pictures of some examples. I apologize, the one on the right does not show a great illustration of the plexiglass shields that are there separating those in the office staff from the person that is standing there on that. Well, there isn't a person there, but where the place marking is for that individual to stand. You'll notice with the lunchroom picture, the dots that are on there, that is one example of how they have spread students out, and you can see that they're staggered on each side, so that there's not talking to someone directly across from you. They are down a little ways. And again, that's one example of what some of the schools are doing to try and mitigate the risk and increase the physical distancing as much as possible. In regards to the group size, the questions that they're asking there are how many people will actually be in this space. And again, here are several of the examples that are that we have listed just as a quick little summary of all of them. As you've seen with the school specific plans, these are very lengthy. And so we're just trying to touch on a few small points. The one on the right, for example, is a lunchroom plan that a specific school put in place where there is only one grade level in the lunchroom at a specific time, and they only have 4 individuals sitting on each of the tables, and they're all facing a certain direction, very similar to what we've encouraged in a classroom. So it's recognizing the group size. Others are utilizing other space for the lunchtime, including they can utilize outdoor spacing as well. There's the elimination of unnecessary furniture that's taking place. All these things have already been mentioned in many of the other presentations, but and then this 25% capacity, that will be addressed with Dr. Dowdle. He'll be able to speak to that a little bit more as he's addressing the large gatherings at events such as the UHSA sponsored sporting events. And let's see, so the group size, they're again looking at all of that. The respiratory output, again, this is another one that Leon had touched on in regards to the circulation, the air filters being changed out, the physical distancing, utilizing that larger space, and then obviously the face coverings that will be worn. But in regards to some of our other classes, meaning choir, music. Again, that is in an upcoming slide that will address that specifically as well, because that's really the challenge when we're, what's the word I'm looking for, but when we're singing or we're playing an instrument, that respiratory output, thank you so very much, it increases. And so there are things that they are doing to address that, including just larger spaces and utilizing even some outdoor space if necessary. The touch component, again, it comes down to a lot of that personal responsibility of keeping our hands clean. Most of the plans, especially in the elementary setting, talked about the kids using hand sanitizer as they come in, as they go out, and all, throughout that process and period. But at the same time, there are those times where they'll be cleaning in between certain specific areas. I know there was a question earlier about cleaning any shared items. Most of our elementary schools especially are not looking at, but are providing individual supplies to try and minimize or eliminate some of the shared items that have typically been used in the past. However, with Leon's presentation on all the different cleaning materials that are being provided, that will be taken care of as well when necessary in between. And we're continuously talking to teachers and administration on how we might be able to do that, on top of using that hand sanitizer for the kids as well, to hopefully not make that cleaning process too extensive.
Portables. So how many portables do we have that the teachers and the kids have to go out their doors, in new doors, out the doors again, that would be looking at touching constantly those doors?
You bet. So that's a really great question. I don't know if I could answer specifically how many portables we have, me personally.
Or how many schools have portables, maybe would be a better question.
But in regards, yeah, please. I don't know the number.
We have about 80 portables. About 20 of those are used for storage or to hold non-student classes. I guess brain boosters could be considered a class, but the coach or others.
But the brain boosters are going to rotate into rooms this year,
Yeah,
correct?
so-
I understood that
So
right.
we have roughly 55 to 60 where classes are taught.
So how many schools would they be at?
I would think there are probably 15-ish, 15 or so of our buildings have portables.
So we'll just have those schools determine how they're going to be able to come in and go out again again with sanitizing.
Yeah, that's where I was going to go with that after Leon mentioned how many portables we have. And that goes back to your point earlier of having the teachers have that opportunity to discuss that as well, if they're the ones that are being impacted with having to come and go, of just how can we address that, and with the movement and the flow back and forth. And so there are lots of different options. We have gloves that they could grab a glove as they go and pull open the door, using hand sanitizer just as they come and go, whatever the case may be. So that will be an ongoing discussion as well.
Okay.
In regards to the congestion, we touched on this a little bit already with the hallways and the different things that are going on there, but are there high points of high congestion? And we obviously know that in a lot of our schools that is possible, especially in our secondary schools. But what our schools are looking at are really adjusting and putting different arrival and dismissal, even passing times, dismissal times, everything, adjusting those and trying to stagger those specific times so that there are fewer opportunities for that. We talked about the transition time between classes, but the entrance and exit points, those will be clearly identified for any patrons that are showing up throughout the day. And then classes and grade levels entering in staggered times. There was a question asked about what that might look like. So for example, in the middle school, they're establishing entry points for grade levels and or classes directed to their first class period as soon as they arrive. Another example is that they're assigning specific areas to enter and exit because they all arrive at different areas. Like a student that arrives on the bus might be on this side of the building versus another one. And so they'll be taught and directed to enter in specific areas. And then additional lunch periods have also been created to address congestion that can take place within the lunchroom as well and shorten that time of possible exposure. And then in the high schools, some of the things that were mentioned is that the schools are considering using 0 period and an after school period to help stagger the students' entry and exit from schools, as well as reduce the number of students in the halls. And then just reducing that passing time, which we talked about. And then asking students not to come early and to leave as soon as school is over. And then additional lunch times have been established to minimize. So very similar in nature, but it's different with every single school and how the building is laid out. And then obviously the face coverings will be worn, and then just eliminating, those large group gatherings, which include the assemblies, overnight travel, and field trips. So that's kind of a quick summary, and please, I can't stress enough that this is not comprehensive in any way, shape, or form. You've seen the school plans. They are pretty extensive. And so I strongly encourage anyone that has any questions to go and look at those, because they are so unique to each of the schools. But they were asked to address these 7 characteristics of a situation to make sure that their plans were as solid as possible as we walk in. So any questions?
Mr. Wrigley.
Yeah, I have 2 questions. First off, what are we doing in regard to cohorting? It probably is easier in the elementary than it is to the middle, but a lot of the plans suggest we try to cohort, keep kids as much as we can. And hopefully they're cohorted with people they like. But anyway, cohort kids so that if there's an outbreak that sort of keeps it within this little cohort rather than whatever. So can you tell me what's going on there?
You bet. So I think you hit it right on the head that elementary is a much easier way to implement the cohorting. I don't know if that's necessarily a word, but
that is actually what I've got it down here.
Perfect. Even better. And so that's very, very simple in that regard. The middle schools, they do a lot of that already with certain grade levels. And so that makes that a little bit easier as well. It becomes very difficult when you get into the high school situation, when you start going down different paths. I may need a science class, and you look at all the different offerings that we have for a science class. What I choose to take for science may be very different than what you choose, Steve, for science. And so us being able to stay together throughout the day makes it very, very difficult. However, where we can make that happen, they are.
Such as the core classes.
Correct. Yeah.
Ninth grader has typically 7 core classes, and we could try, it's not crazy, but if you could keep the core class together. The second question I have is, have we shared any of this with the seminaries so that they're actually being able to follow some of the stuff that we're doing?
That's a really great question. To be honest with you, I trust our principals wholeheartedly, and I would not be surprised. I probably shouldn't confirm 100% that this has happened, but I would not be surprised if they have not already done that on their own.
Okay, because we don't want an outbreak happening in the seminary.
Absolutely.
Because I'm sure they would. I had several seminary teachers that are asking us, so what are we doing, and how can they help? So
the fact that the school plans themselves were put and made available on August 1st. They do have access to those, but that's a great point, and we'll make sure that
just to be able to coordinate with them, since we have so many of our students for one period a day are leaving to go into seminary. It'd be great that we coordinate to make sure that's not a period that they're not following the same guidelines.
Absolutely. We'll make sure that's passed on. Thank you.
Other questions on this item?
Great.
Thank you. Okay, it looks like Dr. Dowdle is next up.
Hello, nice to be with you. I'm going to talk about a couple of our activities, which are higher respiratory output, so performing arts, and also our athletics type activities. So some of you have already read the Colorado State University study, which is ongoing, but they have some preliminary results that are out. Just to cover a few of them that are fairly obvious, that masks should be worn by all in the room, and they are recommending limiting talking. They have found that physical distancing of 6 feet is effective in this particular type of activity in performing arts. Also, straight line seating should be used when possible. Masks designated for singers and instrumentalists should be used. The one for singers kind of looks like a duck bill. The one for instrumentalists has this little slit in it, so you can put the mouthpiece into your mouth. Also, bell covers that cover the end of woodwinds and brass. Also, the use of puppy pads when you need to dump out your spit valve instead of putting it on the floor, which is traditional You put it onto a little pad. I know that sounds gross, but that's past tradition. Also, outdoor practice and performance is best. So there's a little bit more to it, but I think some of you have probably read that study already. We've had conversations with Sherry Jorgensen, who is our specialist for this area, and she has created a list of supplies. She was all ready to go with that before some of us learned about the study, which included the supplies mentioned in the study. And she has administrative support to move forward with that order. It's about a $75,000 order to get us started. And she was very, very happy to find out that we were very supportive of that. So that's a very important thing for us because we have so many students who really enjoy being involved in those types of activities. With the Utah High School Activities Association, earlier there was a reference to the updates. The last update that they're using actually came out on July 28th, so it's fairly recent. And in yellow phase, the association guidelines include maximum of 6,000 in attendance outside and 3,000 inside. Student participants need to have symptom and temperature checks, which they do. So all of our students who have been involved in practices, that's what they do before they get going every time. They have a temperature check and they go through a health checklist. And Steve, they also stay together in cohorts. So that's one of our teams had well, more than one has had a problem, but the one I'm thinking of, they were able to quickly contact trace the individuals involved because they were in a cohort, and they've been effectively using that in most cases. They have limited players on the sidelines to 50 for football and 25 for all others. It's required that, oh, thank you. I'm not paying attention to your notes, I'm just mine. Hand sanitizers must be available. Also, individual hydration containers instead of what they've traditionally used, which is kind of a group gathering, watering hole type approach. And face coverings as per district, local, and state direction are required in their guidelines. There's more, but you kind of get the good flavor of what they've done. They've covered many of the important things. Granite School District actually organized a gathering of the directors of high schools in the Salt Lake County and actually beyond, included Davis County and Alpine or Utah County. Thanks again. And yeah, I should have paid somebody to do that, but we got together and had a discussion about what we could do as a group because our teams go into these different counties and play with these regions that mix, and we wanted to create the safest environment possible for the players and for the fans. We started the discussion with a Big Ten discussion of what they've decided to do as an athletic conference, and they've limited their attendance to 20% of capacity at their venues. So that's where we started talking. We wanted to start cautiously and then perhaps re-examine what we're doing. And the group settled on the idea of starting with 25% capacity. That would be in the stadiums, gymnasiums, and auditoriums because the activities actually take place in all three of those venues as we meet. We're going to meet at the end of August after the first couple of games. One or two have taken place. Quite frankly, we thought that if we started a little bit small, we could see how it goes, test it, try to start building a culture, and hopefully see where that goes. We know that one district in the state way down south decided to go with full occupancy and just place a sign outside the stadium that says this is not a COVID-free zone. We chose not to do that. We've also elected to use electronic ticketing so we don't have an exchange of money or tickets. And at the time of buying that ticket, you can also have an agreement form that you check before you are able to buy it. which basically says you need to, in outside venues, have 6 feet or masks, and inside venues, you have to wear masks. So that's the guidelines that we're working with. So that covers what I had written down, but I'm happy to answer any questions that you might have.
Mrs. Oaks.
So one of the questions I've had a lot is with regard to how students will hear their teachers. I'm assuming most teachers already have microphones. Is that correct? And they're going to be able to use those with mask on. Have we tested that, like, to see how effective it is? I'm just curious.
I don't know that we've tested our audio enhancement systems with masks. I would think they have, but I haven't confirmed that. It's a great question. But yes, most of the rooms have audio enhancement.
I mean, I just think about if I'm a teacher and I have to wear a mask.
That was a really big push in the past decade.
Uh-huh.
Most of them really did get.
Most of them have them.
All? Okay, they all have them. Thanks.
Great. All right.
This is my support team here. They knew that better than me. I knew the high schools did.
Okay, any other questions for Dr. Dowdle?
I think it's the appropriate department. I don't know if it actually fits this one, but we're getting a whole bunch of questions. I think tonight's been great. It's gone forever. We're not following the 15-minute duration thing, sure. But
Mr. Wrigley, I'm sorry, just wait a minute. Is it relevant to his section?
is this the last person speaking?
Well, I think Dr. Robbins was going to come up.
All right, I will
Yeah.
ask those questions of him.
Okay, thanks.
Okay.
Anything else? Okay. Yeah.
That's it on the slide deck. So I just want to tell the team thank you for all of their efforts to put that together, and appreciate the questions. And if there's more, I can take those if we're ready to move on.
I think there probably are some more. So
Okay.
now, Mr. Wrigley.
Now's the appropriate time. Thank you so much. So over the, we've answered a lot of the questions I think I've got on the emails and stuff. There's a couple that I don't think we've answered that may be quicker to answer here than 1,000 emails. And I'm not sure the answers. We've had several questions in regards to AP courses, concurrent enrollment courses, or honors courses. If you're online, what are we doing in regards to that? Are we offering those courses online? I know we're offering them to go into the programs if they would like to go, and which is novel if you want to go into a particular program even whether you're online. But tell me what we have, because that's a really common question.
So currently we have 12 AP courses, which are going to be offered online. And the IB courses, Greg Levitt is working to make sure that most of the IB courses, not all, are going to be accessible with a blended type approach. In other words, they're going to be able to have live mics, is my understanding, and do an online type approach.
Okay. And the same thing with the DLI and the SALTA? What is our plan on the DLI?
DLI and SALTA. So Amber?
It'd be hard to do DLI, I guess, but yeah.
DLI and SALTA.
Yeah. So because I had parents ask us about, if they want to do DLI, can they do a DLI online, or is that theoretically it's hard to be immersed on Zoom, but I guess you could.
So right now there will be 2 options available for our students who are participating in online learning who are DLI students. The first option is to attend the DLI instruction. Sorry, I've got a little frog in my throat. Would be to attend the DLI instruction in person, even though they're doing all of their other coursework online, or the state has just agreed to develop courses for online DLI students 1st through 9th grade. So those will be available. We're hoping very close to the start of the school year. Thanks. And those will be independent but interactive. And so the state is still working out some details in terms of how we will get access to those courses and support our students who are taking them. So that is what we know now.
Sounds good. SALTA, what are they doing in regards to SALTA?
So SALTA, great question. SALTA parents were just notified last Friday. We are going to have the opportunity to offer SALTA online for 2nd through 5th grade. So they will have the opportunity to take their courses online with a SALTA teacher. And then for the middle school, there will be a SALTA math class option for 6th, 7th, and 8th grade. And then the other core courses will be available online through a general ed teacher, and there will be extensions added to those courses that our SALTA teachers have been consulting with us on to build.
And in the online for the high schools, are honor classes or not?
There are not honors courses. However, every course is being developed with honors extensions. So students who are used to going to that level of depth and complexity with their learning experience will have that opportunity with their online core courses as well.
Okay. And my last question, this is really, Nancy, this is my last question here. Thank you. So on our Canyons learning opportunities options, I've had some parents ask, first off, they've been very pleased that on our online, we've allowed some in class. That's really going to be helpful, especially for the performing arts and that. So that gave us some options on that. On our in-person instruction, for 5 days a week, we have the last sentence in that sort of talks about COVID or parent excused. And then the division or the district put out tennis will be recorded daily, but students who do not attend in person because of illness or other personal reasons will be able to keep pace by working with the teacher and accessing Canvas and other resources. I've had several parents that have either pushed for the A and B because they wanted a smaller class size or they didn't want their kid there as many days. Is there an option for a parent under this model to be able to decide to go 2 or 3 days a week to the 5-day model?
Is there a scheduled and structured option for them to do that? No. Is that their parent choice to be able to do that and teachers continue to support just like they always do when students are absent? Yes.
Okay, so it is feasible if they choose to do that. Because I mean, I've got parents that are concerned about, there's parents concerned about so many kids in the classroom for so many days, and I'm just looking at other options for those parents.
There we go. No, just as Amber said, Steve, that is built within the plan and has that flexibility. Rather they choose to attend which day is best for them is up to the parent and the student. I think what Amber's referring to, the difficulty would be to register for those days.
No,
but
I'm not saying that.
but yeah, but I think what you're getting at is that's within the framework that if, maybe their level of fear has risen during the week for some reason and they decide, okay, remember 990 hour attendance rule has been waived. So that accountability measure is no longer there. So if they choose, hey, it'd be best for me. I feel, this week, Monday, Tuesday is going to be best for me. They still have the support on Canvas to stay up to pace and stay with the class.
And the parents I've talked to, a couple have said that they would feel more comfortable not going all 5 days and then choosing to do what they did. And as things got better, they would just gradually move back to all 5 days. But I could see this if we have a scare of something happened in school. What are they going to do? I got to send 5 days, or can I choose something that? How will we get this out to parents to let them know this is an option?
I think we've built it into our website with that language now.
I did see this in here, but
I don't know if we were going to update the language with parents choosing days of the week that their student may attend. Right. Okay. So that will be there. I think too, in fairness to staff as well, I see this kind of an ebb and flow, like you said, depending on what's happening. And, I think this is kind of that one of those pieces that really is a new normal. It's going to be a learning curve. I totally recognize that. The fact that all of our team, all of the ISD team and our coaches just have gone through training with our teachers on Canvas, that hopefully we're building a baseline for that. I actually see potentially some really nice crossover between what's occurring in the online curriculum content development and listening to our coaches and those that are developing that content. I would see the future as being content development and curriculum development, even expanding more under Amber's supervision, so that those teachers are able to access that and pull that down in person for in-person instruction and utilize that as students ebb and flow in and out. Because I think, you know, depending on all these things that we've talked about tonight, all of these data points are going to influence, you know, how people perceive that and their safety levels. So.
Well, I see a parent, for example, if a sibling gets sick, not even the particular, they may choose to keep that child home, which is an option, would be very helpful for us. Or if they're just not feeling very, in other words, I don't work, but I could take care of my kid 2 days a week. That might be an option. I don't know. I'm just trying to give parents another option. It would also reduce the class size, which is a benefit for the teacher also.
I could see those class size, that ebb and flow could be, you know, that could be many kids or a few kids each day, depending on what the environment, you know, might be like with community spread or any other factor. So
well, it
those are
seems
great.
to fit within the model the same way we did within the individual models. Not really a change, but just empowering parents the same way we did the other one.
Yeah.
Thank you. That's all I have.
Thank you, Steve.
All right. I think Mrs. Oaks had a question.
Yeah, so my question is about Canyons Virtual High School. So I've been observing some comments online from parents expressing questions and concerns about the teacher to student ratios with that, whether or not they're going to get the same kind of level of attention and oversight as kids like on an elementary or middle school level. Just curious where we're at with that.
I'll have Bob. I'm not as familiar with CVHS, you know, being new, but I can say what I have observed is CVHS is much more self-guided. That is true. And it depends on the course and the instructor. I think going back to Steve's comments, after this shakes out with what registration enrollments actually are, that we can make better decisions about how teachers are allocated and how we utilize those resources, because it's going to be by course instead of grade level. So it's more specific to the course, which that could enhance what the online experience looks like for our high school students. But CVHS has long been the model that we've utilized, and so that's what's in place. But I think, Amanda, in all fairness, going forward in the future, I would recommend that we look at that, and that could be potentially, you know, not just at the secondary high school level, but overall K-12 in what an online, you know, standalone model like might look like. So Bob, do you want to, is there any, I don't, maybe I spoke to it, but I don't feel too qualified because I haven't been around long enough to really get into the model, but yeah, please, Amber.
So I think it will be important for our families of high school students to understand that through CVHS and then what we're offering for online are going to be two different things, even though they're both online. So the CVHS is going to be a much more of an independent study. So there will be less teacher support than the core classes that our teachers are creating that will be offered and taught through Canvas. Does that help? Yeah. Okay.
Yeah. Mrs. Schill has a question.
Okay, so thank you everyone who has presented. I think there's just been a lot of really good information. So my question is, I think we need to communicate some of this to parents because we're going now into a lot more detail. And so I'm just wondering, what is the plan for communication?
It's full go, ongoing. No, we'll keep working on getting more of these details out, Amber. I as Steve mentioned, you know, there's a lot of work between now and Friday. That FTE allocation discussion will be very in depth. I think with that, kind of going to Amber's point, you know, looking at all of the requests, there's going to be some challenges in that, in meeting the needs of every single student that requested every course. And part of that is that if you remember in the beginning is that we guaranteed core classes we would deliver for sure online. And we opened it to electives, and we'll try to meet as many needs as we can in those electives. But the reality is there will be electives that we will not be able to completely offer. That's probably a question for, a bigger arena and domain as we continue to look at what online and blended learning looks like. But I think, that a lot of that work's going to get done in the next 3 days. And so hopefully, by next week, we can even have, more details. Our counselors are going to be under tremendous pressure, and our administrators to work with these schedules to make them work for sure.
Yeah, this is not unique to us. My son just signed up for college, and my daughter did. And this was a common problem in colleges, getting the classes they wanted, the availability because of online. So this is a problem going everywhere right now.
Well, and I'm not necessarily talking about the classes. I'm talking about everything in that PowerPoint. I mean, the data points we're looking at, like how we're making this decision, what each school plan looks like. Maybe it's just even the principals sending a skyward with the link to the school's plan to make sure parents have looked at it. Because I haven't received anything from my child's school like that. So
The individual site plan.
Yeah.
Well, that's good feedback.
So speaking with the communication, I've had several parents come out and say what communication we have done. They have been really appreciative of it, that they could look and see what we were doing with the online, with the face-to-face, and with giving the homeschool opportunity too. And they really, really appreciated it because they could look at it, read it, and have discussions with their kids and come up with a good plan for themselves. They were just missing some of the points that we were doing to help with the COVID more than anything else. They got the curriculum, they understood the plan that way, and they were just needing some more information a little bit about COVID. And I think we've really covered that tonight. But like Amber said, we just need to get that out. I'm pretty sure it will be wordy, and hopefully they'll read through all of it, but it'd be helpful.
Well, and everything online has been excellent. So thank you. Like the charts,
exactly.
everything has been great. But I'm just saying, I think we just need to continue that communication.
Okay.
Okay. Any other questions on this one? Well, I will add my appreciation to you, Superintendent, and to the entire team for all the great work and yes, the level of detail and thought and preparation that has gone into this, and it is a dynamic situation and always looking to improve, as has been mentioned a couple of times, that looking for ways to improve. So thank you very much. And with that, board, like we mentioned earlier, a couple of these items we will move into the business meeting. So, and I'll say this several times, thank you all for your patience and for being so thorough. We appreciate that. And so, board, would you like a 60-second stand-up break? 2 minutes. 2 minutes break, and then we'll reconvene for the business meeting. Thank you.
You are now unmuted.
In person. And then this is an updated version of the teleconference. One person who's struck out or the strike through is bowed out. Okay. Sounds like the two are still waiting.